Okay, we got everybody. Good. Hi. Good. What is this? Good. Okay, let's roll. Okay. Good morning, buenos dias. Today is Tuesday, March 10th. Let's call this meeting to order. If I could please have our clerk call the roll.
Supervisor Abekoga.
Here.
Apologies, my sound turned on over here. Supervisor Jung is coming up to the dais. Supervisor Ellenberg.
I'm here.
Vice President Arenas.
Here.
President Lee.
President as well. Good morning, everybody.
You have a
go
quorum.
ahead and read the interpretation announcement, clerk.
If we could please have our interpreters translate the following statement into Spanish and then Vietnamese. If you are in chambers and require Spanish or Vietnamese translation, translation devices are available at the back of chambers. The deputy clerk can assist you with setup. Translation is also available in Zoom using the interpretation button. Additionally, as a gentle reminder for public commenters, staff, and those on the dais, please speak clearly and directly into the microphone to improve the accuracy of translation. Do we have our Spanish interpreter on the line? Do we have our Vietnamese interpreter on the line?
Okay, all right, let's do it. Is it okay, Sylvia? Want to go and do the translation notification in Spanish?
Buenos días. Si necesitan traducción para español, las maquinitas creo que están atrás en una mesa y pueden indicarle a uno de los empleados que están trabajando aquí, o también pueden indicar que necesitan traducción y va a haber alguien que está en línea que los va a escuchar, va a tomar notas sobre lo que ustedes dicen y luego van a traducir. Con que eso va a ser nuestro proceso, ustedes hablan español, la persona habla en inglés y traduce los comentarios. Gracias.
Thanks, Betty.
Dạ, kính chào quý vị, cảm ơn quý vị hôm nay đã đến tới Hội đồng Giám sát viên để tham dự cái bữa họp. Hôm nay là quận hạt có muốn thuê những cái trực tiếp để phục vụ, để thông dịch cho quý vị. Cho nên nếu mà ai cần có cái sự giúp đỡ thông dịch đó là xin ra đằng sau tới phòng cô góc đây bên tay trái của Betty, đặng cho có thể lấy một cái máy nghe, đặng cho có thể được nghe có cái người thông dịch cho. Mà Betty cũng thấy rõ ràng là có nhiều người hôm nay có người thông dịch riêng của họ. Cho nên rất là cảm ơn quý vị đã đến hôm nay và xin thứ lỗi là nếu mà hôm nay có trục trặc gì. Cảm ơn.
See, that's why I'm so proud of our multilingual, diverse community sitting right here on this board. So let's give them a round of applause. Thank you, thank you, thank you. Yes, and now may I have Supervisor Allenberg please lead us in the Pledge of Allegiance.
I'll be doing that in English. Please join me in standing if you're able. Ready? Begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. And next, we will pass this over to Vice President Arenas to introduce our invocator this morning.
Good morning, buenos días, and happy Women's History Month. Es feliz día de el mes de la mujer. It is my honor to introduce today's invocator, a woman I admire very, very much, and I see her coming our way. It is Ruth Silvertaub. I expect music to happen when I announce her. Because she is an amazing human being, not only to women, but to the rest of our community, as she is a giver and a really a public servant, even though you don't work for technically for the government, but you work for the community. Let me tell you a little bit about who Ruth is by telling you the service that she provides in our community. She's the supervising attorney of the Workers' Rights Clinic at the Catherine and George Alexander Community Law Center at Santa Clara University School of Law. She is the supervising attorney of the Santa Clara County's Office of Labor Standards Enforcement Legal Advice Line and a member of Santa Clara County's Fair Workplace Collaborative. She's also the Legal Services Chair of the South Bay Coalition to End Human Trafficking and a founding member of the Bay Area Equal Pay Collaborative. And as we celebrate Women's History Month and this year's theme, Leading the Change, Women Shaping a Sustainable Future, let us be reminded of the grateful, and let us be grateful for the women that step up to advocate, protect, and lead, such as Ruth has done all her life. Our invocator today is someone who embodies that leadership through her work as a legal rights, human trafficking, and employment attorney, where she helps ensure the people are treated with dignity, fairness, respect, and opportunity. Through your advocacy, Ruth, you've been helping shape a future where the rights and voices of all workers and survivors, especially women, are respected and protected. Thank you for all that you do for the rest of us, for being one of the hardest working women I know. And thank you for joining us today and honoring us with an invocation.
Thank you for the kind words. And thank you for inviting me to provide the invocation for Women's History Month, Supervisor Arenas. We commemorate Women's History Month against the backdrop of a relentless assault on reproductive rights, women's rights, constitutional rights, and workers' rights. We are seeing in real time the advocacy of traditional gender roles and systemic gender oppression, making the dystopian elements in The Handmaid's Tale feel like a reflection of modern real-world political trends. The EEOC, where I once worked, is placing ads soliciting white males to file discrimination claims, focusing its enforcement on reverse discrimination and DEI policies that benefit women and people of color. ICE agents are detaining and or kidnapping primarily non-white people, including women and children, warehousing them in concentration camp detention centers under brutal conditions and deporting them to third countries without due process. Women are disproportionately victims of sexual assault, domestic violence, and human trafficking. In a 2018 study, 81% of women reported that they were a victim of rape or sexual assault in their lifetime. In these bleak times, it is easy to give up hope and to despair, but there is a reason to hope. In the 1970s and 80s, Santa Clara County was dubbed the feminist capital of the world because San Jose had a woman mayor and a majority of women on the city council. Santa Clara County is regaining that title with 4 out of 5 female county supervisors. The powerhouse women sitting before me or in front of me, Supervisors Yun, Abe-Koga, Arenas, and Ellenberg. I'm inspired by working women in labor, tradeswomen, immigrant women leaders, indigenous women leaders, Asian, Latina, and Black women leaders, women service providers, and women in legal aid organizations. A 2018 report found that Latinas in the San Jose metro area have the largest pay gap in California, earning only 33 cents for every dollar earned by a white male. However, I am inspired by Santa Clara County's efforts to close the pay gap by enacting an equal pay ordinance and signing the California Equal Pay Pledge. Women are disproportionately affected by wage theft in California, particularly in low-wage industries like retail, hospitality, agriculture, nail salons, restaurants, and care work. I'm inspired by the county's restaurant permit revocation program for unpaid wage theft judgments, the county's wage theft dashboard, the OLSC, the Free Legal Advice Line, the Human Trafficking Commission, and a unit in the county council's office that has filed wage theft lawsuits. I'm inspired by fast food workers, 2/3 of whom are women, who have organized and mobilized to increase their wages to $20 an hour, and by the county that now has a retail food advisory council and is on the verge of enacting an ordinance that provides Know Your Rights training to fast food workers. A recent report reveals that 93% of fast food workers had not heard about or did not know basic workplace rights or have access to benefits. I'm inspired by the advocacy of care home workers and also home care providers, 80% of whom are women, and by our county, which now has a residential care facility advisory council that is addressing problems like rampant wage theft and health and safety issues like the lack of Hoyer lifts to prevent injuries. I'm inspired by the county's Office of Women's Policy that actively promotes gender equity projects such as the Womanhood Project, the When Young Moms Thrive, We All Do, and the Caregiver Returnship Program, and the Offices of Gender-Based Violence, Immigrant Relations, Disability Rights, and LGBTQ Affairs that address the intersectional issues that women face. Finally, I'm inspired by those trailblazers who came before us and are no longer with us. The late organizers and social activists in our county, Sophia Mendoza Rosdeen, Ernestina Garcia, farm worker organizer Dolores Sosa, and Yasmin Fernandez, a fearless 35-year-old fast food worker leader who collapsed and died on the job when she was forced to go into work with pneumonia. I'm also inspired by the women trailblazers still with us who have spent decades fighting for women and immigrant rights, like the courageous Sally Armendariz of Caras, whom I read about in law school, and who filed a lawsuit that led to a law that changed the legal landscape for pregnant women, and Maria Marroquin, executive director of the Day Worker Center of Mountain View, who was awarded Local Hero by KQED, as well as many other women too numerous to name. As Arundhati Roy so eloquently stated, there's really no such thing as the voiceless. There are only the deliberately silenced or the preferably unheard. Women, especially women of color, have for much of history been deliberately silenced and unheard, and this administration is working day and night to roll back the clock. During Women's History Month, we can derive hope from the power of women and their allies to organize and mobilize to support women's rights, immigrant rights, and workers' rights, and to resist efforts to roll back our rights as generations have done before us. Thank you.
Thank you very much, Ruth. Before I move forward, I just want to ask all of you, especially those who came here the very first time, welcome to our board chambers. We would like to ask you to please turn off your phone ringer. And if you can't do that, please go just turn off your phone for the time while you're here, so we respect other people speaking, so the phone is not interrupting. Thank you very much. All right, moving on, we don't have any items number 4 and 5. We're going straight to item 6, which is the public comment period, an item reserved for members of the public to address the board on any items not on today's agenda. And anyone who would like to speak on items on the agenda should request to speak at this time. Please fill out a speaker card and return it to a clerk. We will call up to 30 names now, and then the remainder names will then be called at the end of the agenda. In-person speakers will be called first, followed by speakers on Zoom. No further requests to speak will be accepted after the continued public comment period in the afternoon. Reminder for the public on Zoom, as soon as the first speaker in chamber starts speaking, there will be no more speakers being taken. During the public comments, to respect everyone's comment, we do not allow applause or boos. In order to show your support, you could raise and shake your hands quietly. Okay? And so I just want to say first, thank you for your cooperation to keep our meeting moving orderly and polite. All right, thanks, Clerk. How many speakers do we have today?
I currently have 12 cards in chambers, 2 hands raised on Zoom. Looks like that is holding steady at 14 speakers.
Okay, then that's 2 minutes each.
All right, I will call up names in batches. You may approach the podium in any order once your name has been called. Our first group of speakers, Leslie Coleman, Jocelyn, Francisco Franco, Farshad Ghazi, and Jose Rivera.
I don't see it. Please.
Yes, you could just line up right here. The mic is on the podium, so yeah, great.
Great. Thank you. Good morning.
Good morning.
My name is Leslie Coleman, and I am an IHSS provider. I cared and provided for my mother, diagnosed with dementia, who ultimately passed away. Not too long after, I got laid off from a 30-year career of IT recruiting. With my passion for helping others, I became a provider for the IHSS program. I am now caring for 4 recipients, which means I'm working 12-hour days, including Saturdays. That's so I can bill the maximum hours just to get by. My recipients need me, along with other providers, in order to help numerous recipients that are in need of assistance. The demand for this care is real. You've heard from many family providers that they have made enormous sacrifices to do this work for family, friends, and loved ones. We are all passionate about helping others. We are all also working long hours, sacrificing time with our own families just to have ends meet. This is not sustainable. The IHS program is in need of a fair contract with wages and benefits that can meet the cost of living in the Santa Clara County. Thank you. I would now like to introduce one of my recipients, Jocelyn.
Hi, my name is Jocelyn. I'm a recipient of IHSS. I support IHSS all the way. If I didn't have IHSS, I don't know where I'd be. IHSS has helped me more than words can speak. They've allowed me to live in my own apartment. They're teaching me how to cook my own dinners and become more independent. Please, please, please keep IHSS. I need it, and so do others, to help us thrive in life. Thank you.
Hello, Supervisors. My name is Francisco Franco, and I'm the husband of Felicia Franco. I am a recipient of IHSS. I'm the care recipient of IHSS. I've lived in Santa Clara my whole life. I've been disabled since 2016, and I've lived in Santa Clara County my whole life. My wife has been able to take care of me and been able to get paid has been a blessing. We've been able to get off assistance. It's helped us a great deal in moving forward. But with everything going up in price, we've taken a step back. Our energy bills have nearly doubled. We have to juggle our bills. We have to decide whether we're going to pay for groceries or pay the minimum balance on our bills or even skipping meals altogether. It's very hard for families like ours. We get up and then we fall back behind. leaves us with a lot of anxiety. I don't want to leave San Jose, where I grew up. I hope you would consider increasing the benefits of these providers, who I would like to turn around and say thank you, and who do such incredible work. Thank you.
If I can call a few more names, we have Kim Ivor, Kay Gebrehewitt, Chris Liberia, Monique Huckabee, M. Trout, Rhoda Fry, Eduardo Carrasco. Please go ahead.
Hi. Good morning. My name is Farshad Ghazi, and I'm an IHSS care provider. I've been a care provider for a few years now, and initially my mom, and now my mother-in-law. And I cannot say thank you enough for having this program in place. I want to thank everybody who fought earlier to bring this program, and it's absolutely needed. You know, providing care for your family is not, and this IHSS is not just about getting money, but it's also getting closer to your family members and also reconnecting with your roots and your past. They are the links to those. And it's no secret that this is not a living wage. It has helped transitioning, but it definitely needs to be strengthened, and it needs to be providing a kind of affordable cost of living expenses. And right now it's not. It's falling far from it. Nowhere in Santa Clara anybody can afford this. It's a wonderful program, but it needs to be strengthened. And I want to say thank you to everybody. People are leaving their high-paying jobs, and the alternative is providing care. Every care that we provide for our family members is going into the community. Every dollar that you add is going back in the society, in our community, and it's a multiplier effect. So I'd like you to consider increasing that, and thank you very much.
Good morning, councils, officers, executives, and supervisors. My name is Jose Roberto Rivera. Everybody calls me Robert. After spending over 40 years outside the Bay Area, one day my mother called me to tell me that she was diagnosed with breast cancer and rheumatoid arthritis, and she had to go through chemo and surgery. She asked me to return to the Bay Area to take care of her. When I got here, I found out that other family members were getting TLC care from IHSS. That's when I learned about the program. I learned that IHSS is not just another job. It's an essential service that allows our loved ones to live with dignity, safety, and independence in their own homes. So naturally, I became an IHSS caregiver. And what this program does to families and patients is truly extraordinary. But the demand for care is growing fast, and our loved ones need more caregivers. With the cost of living in Santa Clara County skyrocketing, fair wages, benefits, and a strong contract are essential to protect this program for both current and future caregivers and loved ones. And our collective support is the most crucial element to make it stronger and keep it alive. If you have compassion in your heart, I encourage you to become an IHSS caregiver and become part of the SEIU 2015. Because caring for someone is not just a job. It is an act of humanity, dignity, and love. We take care of our loved ones while SEIU 2015 fights and wins to take care of each and every one of us. Together, we win. Thank you.
Good morning. Just for the record, my name is Chris Libera. There's no I in my last name after the E. Good morning. I'm here in SEIU as a member of SEIU 521 in solidarity with SEIU 2015. These IHSS providers ensure that seniors and disabled receive necessary care in their own homes. They are preserving the safety and dignity of our most vulnerable residents, which someday we might become, while keeping them out of expense facilities, saving the county millions of dollars every year. Please give them the strong contract they need to continue saving our community. Thank you.
Good morning. My name is Kim Yvonne. I'm the Executive Vice President of SEIU Local 2015. And as you heard, IHSS workers here in Santa Clara County are doing the essential work of caring for more than 37,000 of our constituents, seniors and people with disabilities, affording them the incredible choice to age with dignity and be provided with supports to live full and independent lives, affording their family members the ability to work, knowing that their loved ones will be cared for. They are central to a vibrant economy in Santa Clara and a thriving community, and on the front lines of a growing long-term care crisis, which, as you know, is fueled by a shortage of local care providers. It's no wonder why there's a shortage. 78% of IHSS workers in this county must work multiple jobs to stay afloat because their wages are too low to survive in this area, and they're being compounded right now by the economic downturn we're experiencing. We also have care providers that have dedicated their entire lives to the care of their disabled children. This is an act of love. It's an act of community to ensure that we are all taken care of. The demands placed on them must be met with commitments to allow them to continue to care for us all. The current proposal is not enough to meet the needs of caregivers and the communities they serve. More than half are on food assistance and struggle to pay their rent. Their power is that they care. They have the backs of Santa Clara, supported the critical healthcare system in this county by helping to pass Measure A. They have the backs of our democracy and our community to make sure we turn back the impacts of H.R. 1 by passing Prop 50 and taking back the House in June. They need you to have their backs by budgeting for the county's care future and their dignity.
Thank you. Yes, next speaker, please. Sure.
I believe that we will win. I believe that we will win. I believe that we will win.
All right, we're going to take a all right, we'll wait 30 seconds for people to depart from the chambers, and then we'll continue with our meeting. Sorry for the speaker. If you just give us let's say 30 seconds. Thank you. Okay, let's resume our meeting. Yes, sorry about that. Yes, you have 2 minutes. Please go ahead.
Good morning. My name is Kabrab Geber-Hewitt, and I'm an SEIU 521 member and also Chief Steward. I'm here in solidarity with SEIU 2015. SEIU 2015 members fought alongside us to pass Measure A and help soften the H.R. 1 cuts impacting the county budget and make sure we kept our hospitals and critical healthcare services running. They fought to take care of our communities. It's time for Santa Clara County to take care of SEIU 2015, our siblings. Thank you.
Thank you very much.
You forgot your candle.
No, that's fine.
All right.
Yes, Ms. Fry, go ahead.
Hi, I'm Rhoda. I'm a little overwhelmed
Good morning.
by the testimony here and just the activity in the room. Anyway, I'm begging you to reach out to the fire department and our governor to stop a massive housing development in Cupertino that could cost lives from wildfire. The housing element entitled 51 homes on 2.5 acres, where about a dozen would have been allowed. Since then, the area has been assigned to a very high fire hazard severity zone. That is the highest in our state. And there's a recent Cupertino fire plan showing that our effectively only exit road in a fire is at overcapacity by 4-fold. There are 3,200 students in schools within a mile. Worse, some of the homes in this area have pumps to get adequate household water pressure. The proposed project doesn't even have a 30 to 100 foot defensible space, as is normally required. It only has 10. Fire department is not looking beyond the property line. There's all these rules. Meanwhile, the officials are hiding behind these new state laws, even denying us CEQA. Your constituent lives are at stake. Look no further than Oakland, Altadena. Make the list, please. Prevent the next disaster. Go to county fire, the governor. We have a March 17 deadline in Cupertino. Please, put on your hurry-up shoes and help us out, because it's on you. The fire department reports to you guys, and we're depending on you. Thank you.
Well, I'd like to talk about COVID-19. Excuse me, COVID-19 Lies by Brian Ardis, very well documented. In Chapter 7, he mentions that the University of Arizona studied 300 people that died during their COVID treatment that Fauci recommended with remdesivir. And guess what they found coursing through their veins in their blood? The primary reason was rattlesnake venom from China, Chinese rattlesnake venom, and Chinese crate snake venom. And you can still, it's all documented, you know, and none of them were bitten by a snake. So obviously it is all about snake venom, when not a bat. Remember, we were told it came from a fish market or a bat or a pangolin. No, it's all, even early articles, they had like about 5 different articles way back in January, February 2020 that had to do with this. Now, of course, as a Christian, I'm relating this all to the Revelation chapter 20. And in Revelation 20, it says that Christ threw Satan in the prison for 1,000 years, and then at the end of the 1,000 years, Satan is loosed for a little season. And what's Satan all about? Lying, stealing, murdering. Jesus said he's the father of lies, and everything we've been told about COVID has been a lie. The nurses, the doctors, the government, everything. The only right thing was when Trump mentioned hydroxychloroquine worked, and hydroxychloroquine does work. But Operation Warp Speed was deadly. It killed a bunch of people, didn't save or protect anybody. And, you know, so I hope you read this book and do something about it, you know. And Jesus saves. He died on that cross. I know you've heard this, but this is the gospel. He died for our sins. He raised for our justification. If you believe, boom, you'll be zapped with the Holy Spirit. Yep.
Last call for Monique Huckabee and Eduardo Carrasco.
Okay.
All right, we will move over to our Zoom speakers. Our first speaker is Parent.
Yes, well, good morning to you all. Jeff Rosen is doing some very terrible things to our community. Let me tell you that he's helping to cover up the sexual abuse of my children, and he's incentivizing and allowing somebody to physically assault me and also to threaten to kill my kids. He knows this person. This person is his political supporters, is one of his political supporters, and it's just terrible that we're allowing the district attorney, who's tasked with protecting our community, to be doing these heinous things to our community. I posted a lot of this information online. If you'd like to see this, all you have to do is Google DA Jeff Rosen petition sex trafficking, all those terms together, and within the first 5 results, you'll see what I'm talking about. He's using criminal proceedings to cover up the sexual abuse of kids and not doing anything to protect the kids. I mean, I told him about the sexual abuse of my kids beginning in December of 2017, and he didn't even report it to CPS. He didn't provide a referral to the Child Advocacy Center for my children to get a screening. He didn't do any of that. All he did was file charges against me in order to discredit me. And it's just, we shouldn't be putting up with such conduct from the district attorney. Thank you so much for your time.
Thank you. Our next speaker is Michelle M.
Hello, everybody. My name is Michelle Mashburn. I'm a District 3 resident and an in-home supportive service recipient for just under 20 years. I'm a disability advocate and a member of the Public Authority IHSS Advisory Board. I am here speaking as myself today. Receiving services has opened doors to things I never thought would be possible in my lifetime. And yet, IHSS workers in Santa Clara County are paid below a living wage. If an in-home worker earns a little over $20 an hour in this county where the living wage is over $35 an hour, what does that tell you about how we value this work and the people who depend on it? I've been able to find workers because of their access to health insurance at reasonable rates for less than full-time work. This draws people who have both a passion and a need in their life and allows them to show up with real investment, to do real care. When wages stagnate and premiums rise, I lose workers. I don't get to just move on. I lose care and my independence. Without in-home supportive services, my world becomes very small. I cannot attend meetings, I cannot work outside my home because my energy is focused on the tasks that I currently receive support with. It is likely I would end up in the hospital more and use more services. Further cuts to wages or benefits don't just harm providers, they harm people like me. I ask the board and the county executive to remember this and prevent this harm. As Leah Lakshmi Pipsna Samrasina asks, if care labor is, well, labor, and we participate in an emotional economy all the time, what would a just care labor economy look and feel like? Thank you.
Thank you. That concludes public comment.
Thank you very much. Moving on to next item, which would be number 7, which is the approval of the consent calendar and changes to our Board of Supervisors agenda. And go ahead, clerk, please read the consent calendar update.
All right, we have a request from Supervisors Jung and Abakoga to add item numbers 11 and 12 to the consent calendar. Item number 11 is to approve request for appropriation modification number 116 to $23,509, transferring funds within the Facilities and Fleet Department budget. Item number 12 is adoption of salary ordinance number NS-5.26.50, delineating 1 communications cable installer position, 1 facilities materials coordinator position, 1 gardener position, 1 general maintenance mechanic 2 or general maintenance mechanic 1 position, 1 general maintenance mechanic 3 position, 1 janitor position, 2 senior construction inspector or construction inspector positions, and 1 utility worker position, and adding 1 assistant chief engineer position and 5 stationary engineer positions in the facilities department. We have a request from administration to hold item number 19 to date uncertain. Item number 19 is to approve agreement with Pamela J. Stoddard relating to providing data and analytics consulting services to the Custody Health Services Department in an amount not to exceed $249,000 for period March 10, 2026 through March 9, 2027. We have a request from Supervisor Abekoga to remove item number 31 from the consent calendar. Item number 31 is to adopt Board Policy Resolution amending Board of Supervisors Policy Manual Section 4.21 relating to cap on budget inventory items. We have a correction to item number 38C. The item should read as follows. Supervisor Abekoga appoints Jennifer Glaze to the County of Santa Clara / Ukraine Citizens Diplomacy Commission at seat number 11. We have a request from President Lee to hold item number 44K to March 24th, 2026. Item number 44K is to adopt commendation for the San Jose Chamber of Commerce in honor of its legacy, leadership, and dedication to community in Santa Clara County. We have a correction to item number 44M. This item should read as follows. Adopt commendation for Chief Master Sergeant / Command Sergeant Major retired Michael Frangadakis as he retires from the Veterans Commission of Santa Clara County. We have a correction to item number 46. Possible action A should read as follows. Approve agreement with the City of San Jose relating to pavement maintenance activities in an amount not to exceed $841,211 for period March 10, 2026 through the date of project acceptance by both parties that has been reviewed and approved by County Council as to form and legality. And that concludes my list.
Thank you. Supervisor Young, you have any further changes?
Thank you, President Lee. I would like to make a request. I originally requested for items 11 and 12 to be moved to consent calendar. I actually would like to request if this item could be deferred one more time to the next board meeting. I received word from, our office received word from 521 this morning, and I believe the community organizer is here to speak to this item as well. Are you here, Victor? Oh, I don't know if you're allowed to speak right now, but I just want to make sure that everybody knows you're in the room. And of course, with my deep and sincere gratitude to Facilities and Fleet for having made tremendous efforts in the last year to reach out to 521 to make sure that there was proper meet and confer for this particular two items. But we did receive word that new changes in staffing and community organizers and political organizers at this point we'll be able to communicate and have a proper meet and confer. And so I'm hoping that we could defer this item one more time to allow that process to take place.
Yeah, County Council, go ahead.
I would just note that there are a few comment cards for that item, but if the item is going to be held, the board president does not need to hear that public comment. If it is your discretion, though, if you would like to hear the public comment, you may.
That would be my request, to hold this item to the next meeting. And then
Okay.
on items 33 and 50, I just have some comments. On item 33, excited to see the Reed Hillview Airport Future Planning RFP getting ready to be issued on March 19th, 2026. The envision plan for Reed Hillview was completed in fall of 2020, and the community has been waiting nearly half a decade. How did so much time fly so quickly for the follow-up from that exercise? I look forward to the selection of a consultant to engage the community in providing analysis of their ideas in the envision plan, to highlight benefits and potential liabilities of those ideas, and most importantly, start to ballpark an expectation of costs. I recognize that we are not in a time of plenty, and compromises may need to happen. As we go through that process, so much more important to see full input from the community and transparency during this process. Ideally, the community should be driving what the future of Reed Hillview may be. And I want to shout out my predecessor, Supervisor Chavez, and for the members of this board who had the foresight to approve this item and set the funds aside for this next phase so many years ago. I also want to thank Deputy County Executive Silva Gallegos for moving this project forward with so much heart and passion. And on item 50, I wanted to highlight to staff and to my colleagues that Angela's contractor, who were awarded 4 of the 6 job order contracts, is from out of town. That's not necessarily a bad thing. But I'm trusting our staff to have ensured that the contractor met all the necessary requirements to bid on these projects. And there is always going to be this level of caution on my part that the lowest bids may not always reflect the local market. So I rest assured that our staff will make sure that they are monitoring compliance with our local prevailing wages, which sometimes out-of-area contractors may not be fully aware of. I would like to avoid any misclassifications, underreportings, or violations of the apprenticeship ratio, and I'll be tracking the item to make sure and checking in with our staff on that item. With that, I make a motion to approve the consent calendar with those changes. Second.
Okay, motion seconded. Do we have any public who would like to speak on any of the consent agenda items?
I have one card in chambers and one card on Zoom.
Okay, let's do 2 minutes each.
Okay. Our speaker in chambers is Victor Costa, I believe.
Hello, Board. Hi, Victor Costa, Community Political Organizer for SIU Local 521. We humbly ask that you either delay or postpone item 11. Our members have been trying to speak to management. They have many questions about the situation, and they've been asking to have a meet and confer, and unfortunately, their request has been denied over and over again. So we would humbly ask that we give a little bit more time so that our members can talk to management to figure out the situation. So thank you.
All right. Moving to our Zoom speaker. Our speaker on Zoom is Parent.
Yes, I'd like to speak to item number 40. I'm in full support of increasing our budget to our vendor to help treat children who've been abused and referred by the Child Ethics Center. The only thing that I ask of you guys is that all the children that need to get a screening, that they get a screening so they can get these great services that we're going to provide them. Because otherwise it's just going to be pointless to increase this budget. We're not going to be using this money. Let me give you an example. My own kids are being sexually molested. My son, he'd already confirmed that my ex-wife was letting somebody rape them beginning at the age of 13. There'd been unnecessary bathing with the children, and there was sexual contact between two of the children. And I can't get a screening for them. There's not been an investigation of any kind. I've reported this to the district attorney's office. I've reported this multiple times to the CANC hotline. And nobody will help me get a screening for my kids. I mean, the only thing that I get back is one email with one line from Wendy Kinnear-Rausch. She says, if you want to file a complaint, you can file one with our complaints division. That's it. She doesn't say, I'm concerned about your kids. Let's get them a screening. Let's do something. This is just terrible what's happening to your kids. Nothing. It's just this complete apathy for children being abused. And this particularly is a grievous thing because we have so many children dying in our county and we're not addressing that either. But please, can you guys please help me get a screening? Supervisor Lee has all my...
Hello?
Yes?
Oh, hi.
Thank you. That concludes public comment, and I think we've got a open mic.
There's a technical difficulties. I think we need to get the
Let me turn this off.
phone call mixed up here in our systems in the back there. So I'm sure IT is working on that at this point. Yes. Okay, although I just want to make a brief statement that California law prohibits the disclosure of information related to any investigation of suspected child abuse, and we're not authorized by law to speak to the specifics of any particular case or the results of the investigation publicly. The law also requires child welfare departments to immediately cross-report these type of abuse to law enforcement, so the public can be assured that our county takes all allegations of child abuse and neglect seriously and takes appropriate action. Thank you. Any other speakers?
That concludes public comment.
Thank you. Yes, Vice President Arenas, your light's on.
Yes, I'd just like to take a moment to congratulate our Public Health Department and the team behind the work of item 21, and this is the AIDS Drug Assistance Program Rebate Fund and the state grant that we're receiving for that. I'd just like to congratulate them for continuing to look outside of our systems to pursue funding that will address some of the issues that we have seen on the rise, especially in Latino men. We have seen an increase in a disproportionate higher rates of HIV. And we know that there's real gaps in access and outreach, and then so this grant's going to really help our community this way, which I deeply appreciate. That's it. Thank you.
Okay, you have a motion and second. If no further comments, let's go take the vote.
All right, and for the record, that motion was by Supervisor Jung and seconded by Supervisor Abekoga. Supervisor Abekoga.
Aye.
Supervisor Jung.
Yes.
Supervisor Ellenberg.
Yes.
Vice President Arenas.
Yes.
President Lee.
Aye as well.
Motion carries with 5.
Thank you. Now moving to item 8, which is a public hearing to consider increase of fees for the proof of correction from the Office of the Sheriff. And so let's see if we can get the Office of Sheriff staff to come up.
Good morning,
Good morning.
President Lee, Supervisors. I hope everyone's doing well this morning. Assistant Sheriff Ricardo Urena here with the Office of the Sheriff. With me, to my right here, is my colleague, our Fiscal Manager, Paul Fan. We don't have a presentation, but we're certainly happy to answer any questions you may have on this item.
Good, thank you. I'll go ahead and open up the public hearing first. Let's see, how many member of the public do we have wishing to speak? Curtis?
I have no cards in chambers and no hands raised on Zoom.
I give it 5, 4, 3, 2, 1. Still the same?
Still the same.
Okay, all right, we'll go ahead and close the public hearing portion of this. So, do I have any questions or any comments or motion from my board members? I see Supervisor Young, your light's on. Oh, sorry. Yes, Supervisor Abekoga?
Yes, if there are no comments, I'm happy to make a motion to approve.
Okay, motion?
Second.
Motion and seconded. Okay. See any further comments? If none, let's go take a vote.
All right, that was a motion from Supervisor Abekoga and seconded by Vice President Arenas. Supervisor Abekoga.
Aye.
Supervisor Jung.
Yes.
Supervisor Ellenberg.
Yes.
Vice President Arenas.
Yes.
Yes.
President Lee.
Aye as well.
Motion carries with 5.
Thank you. All right, thank you. Moving to item number 9, which is our report from our County Executive James Williams. Go ahead, James.
Good morning, members of the board. A brief report this morning. I wanted to highlight our continued work related to budget and state advocacy. Wanted to note specifically the California Healthcare Foundation recently released its 2026 survey regarding what Californians are concerned about. And consistent with what we're facing as a county organization and what we're seeing more broadly across the state, there's some surprising and startling findings. In a state known for high housing costs, worries about medical bills and access to health care now exceed concerns about housing, groceries, or other related concerns. Nearly 2 in 3 Californians, 64%, are worried about unexpected medical bills. This reflects the extraordinary cuts in healthcare access from the federal level, and it's not just to Medi-Cal, which of course we've been squarely focused on, but the reality of people actually now having to grapple with the costs of access to health insurance on the health exchanges, known here in California as Covered California, and the many other pressures that people are facing in the healthcare space. We're continuing to push that message in Sacramento, continuing to find allies in those efforts, but this just really highlights how top of mind this is and what a sea change it is from prior years for Californians across the state. Related to a budget, we are continuing to do our work to put together the recommended budget, which will be published on May 1st. We have had recent community engagement efforts and outreach, and we continue to track changes at the federal level and the state level that impact us. We will, of course, provide much more fulsome preview when we get to budget workshops. But I'll give you just one example of the kinds of things that continue to pop up that unfortunately bring negative news our way. For instance, we rely heavily on what is known as the 340B drug pricing program for pharmaceuticals purchased by the health system. It's one of our most significant expenses, as is true across healthcare. Unfortunately, thanks to what's called Trump RX, we are now staring down over a $20 million hit to our pharmacy program here at the county based on cost measures imposed by the federal government on drug purchases. So this is just an example of the kinds of things that we're wading through and working through that continue to pop up on, candidly, almost a daily basis across the county organization. So we will do our best to navigate those things, put all that together, and of course, bring forward a recommended budget that is balanced, but you know, we see shock waves kind of left and right. Finally, just wanted to share that you know, we did complete the bidding process related to the mid-year positions just at the end of last week. We are moving forward with a new effort to ensure that we provide more comprehensive information. These are complicated processes that are challenging to work through, but we are putting together a program called Navigating Change Together that'll be available for all county employees that will walk through the various provisions that are different, by the way, in different definitions in our different labor contracts, that lay out a timeline associated with the budget process, but just try to provide as much information as we can, including when people can reasonably expect to know at what stage and what parts of processes we'll be able to move through. So we will be sharing that with all county employees in the coming weeks, well in advance of the budget process. We know it's something that causes tremendous anxiety, and rightfully so. And we'll continue to take every step that we can to try to communicate what we know and don't know, when we can know what we may expect to know, and to share and provide resources to all of our staff. So that concludes my report today.
Thank you, James. Supervisor Ellenberg?
Thank you. James, I want to first thank you for the budget letter, budget priority letter that our county sent to the chair of the Assembly and Senate, chairs of the Assembly and Senate budget committees, particularly with regard to the items around HR 1. We are decidedly ahead of the curve on this, which gives us the opportunity to shape policy for all of California. The three priorities that you raised are the priorities of CSAC as well, and I'm guessing UCC, as well as the California Association of Public Hospitals, and I can never remember the name, CHIRAC? I can't remember the name, but a variety of organizations representing welfare directors, public hospitals, health departments, the entity of 30 counties, CHIAT. That's what I'm thinking of. The counties that have the indigent care program. And those are first prioritizing continued funding for public hospitals. The second is revitalizing, rebirthing, really, the indigent care program that the state used to provide funding for, but before the ACA and before the Medi-Cal only expansion, and funding to surge eligibility workers at the county level so that we can ensure that we are helping people maintain their coverage as it becomes more complicated and more cumbersome to do that. So I really just want to extend appreciation to you, to your team. I think no one is working harder than we are, and I certainly hope, certainly believe that a lot of this will pay off. Second, and entirely unrelated, thinking about the violence prevention referral that Supervisor Arenas did quite a while ago, I'd like to request a report back to the board at our April 28th meeting with an update on the status of that community violence prevention initiative. I'm sure you recall the report was initially expected back in September of 2025. We were a little bit busy then in the midst of identifying and implementing our strategic plan to address the massive budget shortfalls as a result of the passage of HR 1. So I had no concerns about postponing the report, but now I want to be sure that it doesn't get lost, and particularly before we begin to review the budget for the upcoming fiscal year, I want the board to have a clear picture of the totality of our county's violence prevention efforts, including which departments are directly providing or contracting for work to explicitly address violence prevention. First, hope to have agreement there, and then I just want to say a little bit more.
We can certainly bring a report on April 28th.
Perfect, thank you so much. I know the first May meeting isn't until after the budget workshops, which is why I'd like to get it at the end of April. And really, I've been thinking about this a lot, and in the macro sense, nearly all the work county does is violence prevention, in that the more successful we are at alleviating deep poverty, preventing people from losing housing, assisting families to find childcare and employment, and ensuring access to health care and other vital services, in other words, meeting social determinants of health, the safer our community will be. And this, of course, is separate and apart from the specific work that happens in a more midstream way to stem, interrupt, and prevent violence. And I would encourage anyone at the county or in the public who's interested to look at a recent article in The Atlantic, which notes the national deep decreases in violent crimes following the pandemic and its aftermath, and showing that those can be closely connected to the infusions of funding from the federal government in the form of CARES funding, ARPA grants, PPP loans, and more. And of course, what I'm concerned about now is as the federal government fully reverses course and defends or underfunds many vital services that alleviate poverty and support social determinants of health, we could see a corresponding rise in violence. So I am certainly counting on us, and I don't think it's a controversial position, to do everything we can to ensure that our residents maintain access to the services, programs, and funds that we know create safer, healthier communities from the outset. Thank you, President Lee, for the indulgence of that time, and thank you, James, for bringing that report back in April.
Yes, Supervisor Jung.
Yeah, I just want to echo the same sentiments that Supervisor Ellenberg shared. James, thanking you for your letter of advocacy, the team's efforts. I get to serve on the UCC board, and thank you, Supervisor Ellenberg, for recruiting me and encouraging me to take on that role at the outset of this, not realizing the death and destruction this federal administration was, the extent of it that this administration is going to bring and rain down upon us. I hope I'm not getting too far ahead, but the UCC is developing an ask as well on behalf of the urban counties, very much in line with what we have seen come out of Santa Clara County. It's gone through its finalization process, but it helped serve as a great example of where we should be aligning our voices in our ask. And we just recently voted and approved in the UCC an expenditure to hire a health and legislative communications firm to develop talking points and united messaging across all counties across the state in relation to HR 1 cuts. So we'll see where that goes. But many things developing, I think, really dovetailing our efforts here. Yeah. And thank you, as president of CSAC, you're responsible for a lot of this momentum.
James, good. Okay, so on the issue of violence prevention, as we are now at war with Iran, there has been a lot of other concerns in terms of safety. Obviously, we have seen many of the missiles and launched in other Middle Eastern countries, but at the same time, there's also word of chatter of some type of potential sleeper cells, whatnot, within our country here, and especially in California. So I was asking is, James, if you could work with the Office of Sheriff to see if it might make sense to potentially give us a closed session discussion to see how we are working on doing that work, preventing any potential soft targets like schools, churches, or synagogues to make sure that we have additional security to protect our residents.
We'd be happy to confer with the sheriff's office and confer with county council about what's appropriate to share and in what forum.
Yeah, okay, thank you. First, and then the other issue I did want to ask, you earlier mentioned about the Trump RX program, which sounded like a good program from the public's point of view, saying, hey, this is a reduced cost to our prescription drugs. But it turns out for our county, there is a $20 million hit. And so these type of hits are actually outside the HR 1 bill, am I correct?
That's correct.
Okay. Since there are so many other budget impacts we're getting besides HR 1, we all knew that HR 1 is approximately $1 billion a year. Is it possible for you to come up with a few of these to share with the public so that, it's not so today, if you know it, it's great, but if not, we can provide to us in the future so that we really truly understand the significant impact that we are suffering as a county.
Yeah, the recommended budget will include kind of an overview of the county's fiscal situation and will outline some of the many factors that put us where we are. Of course, that includes local revenues and tepid growth in local property taxes. That includes impacts to other federal funding streams above and beyond HR 1, but also significant state-related impacts, as we spent significant time with the board the other day outlining, for instance, the radical shift in state-related funding streams associated with behavioral health, but it's true for a number of other programs and services as well. So we'll outline some of those. It's of course not reasonably possible to catalog all of those in a way that would be digestible, but we'll highlight the significant ones and the impact that they have on our overall fiscal picture.
Thank you very much, James. If no further questions on this issue, let's move to item number 10, which is our report from our county council. Go ahead, Tony.
There were no closed session items on the March 9th closed session agenda, and therefore no closed session meeting occurred, so I do not have a report.
Thank you. So item 11 and 12 has now been held, correct? And so
That's correct.
Yes, all right. So if that's the case, we are now moving to item 13, which is our Latino Health Assessment Action Plan quarterly report.
Good morning.
Good morning.
Good morning. My name is Ana Lilia Garcia. I am the Chief Equity Officer and the Director for the Division of Equity and Social Justice. I am very happy to be here with you today and really excited to be joined by my esteemed colleagues, executives, and senior leaders from across the organization, specifically departments that are integrating the Latino health assessment recommendations into their work. This morning, we bring you the second quarterly report, which provides information on the county's progress of the Latino Health Assessment action items since the last report, December of 2025. The first attachment is the Latino Health Assessment Action Plan Matrix, which provides the status of approved actions across 7 domains. The matrix now includes columns for county supervisorial districts, cities, and school districts to allow policymakers to identify actions that affect or involve their areas. The matrix also includes actions and strategies related to the disability community, including Latinos living with disabilities. For example, in collaboration with the Santa Clara County Office of Education and various organizations that serve and represent people living with disabilities, the county created a Children and Adults Living with Disabilities fact sheet, which was added as an addendum to the Latino Health Assessment and is now available on the county's Speak Up for Latino Health website. The second attachment is an off-agenda report from the Behavioral Health Services Department on the county's efforts to address Latino suicide rates as reported by the Latino Health Assessment. And the third attachment is a literature review from the Public Health Department on the health effects of overcrowded housing as reported in the Latino Health Assessment. Before I open it up for questions, I want to acknowledge and express gratitude to our community partners and stakeholders throughout this process. We have really appreciated their unwavering support from the development of the assessment to today of the implementation of the actions in the Latino Health Assessment. I will have my colleagues introduce themselves as they speak and answer questions, if that is okay with all of you.
Please.
Great. That concludes our presentation, and we're open to answer any questions.
Thank you. Vice President Renz, would you mind if we listen to public first?
I would love to.
And then we'll come back to us. Good. How many ones in public would like to speak today?
I have 2 cards in chambers, 1 hand raised on Zoom. Looks like we are at 3.
Okay, let's
Nope,
do 2 minutes each.
well, it just went up to 4.
4. Okay, let's do 2 minutes each.
We'll do 2 minutes each. We will close the queue. Our in-person speakers are Maria Dane and Megan Goodhue.
Good morning, County Supervisors and County staff. I'm Maria Dane, Executive Director for Parents Helping Parents. We serve thousands of families in Santa Clara County each year who have children with disabilities. As you're likely aware from our letters to county supervisors in 2025 and our comments to this board, we raised initial concerns when LHA was developed without feedback from Latino disability leaders. We continue to monitor the implementation of the LHA to ensure it addresses the needs of all Latinos, including those with disabilities. At the moment, we are focused on 2 areas, the Community Health Worker Promotora Initiative, as well as the School to Prison Pipeline. Public Health has been working collaboratively with PHP to include the disability voice in their community assessment of CHWs and promotoras. We are hopeful that this will lead to more inclusive solutions being developed. As the county expands its CHW promotora efforts, ensuring that disability expertise is included will be critical to effectively serving families attempting to navigate the very complicated and siloed world of disability services. In addition, we are in conversations with county staff regarding making sure that school-to-prison pipeline data and any solutions developed thoughtfully address the intersectionality of race and disability among our Latino youth. My colleague Megan will have more information on that. Until we have good local data about the intersection of race and disability in our justice-involved Latino youth, we haven't addressed the problem. We are thankful to the leadership of DESJ, who is attempting to gather this data, and look forward to meeting again with DESJ and public health leadership next week on this topic. Thank you all for your work towards making sure Santa Clara County services are accessible to all. Thank you.
Thank you.
Last call for Megan Goodhue.
Hello, Board of Supervisors and County staff. My name is Megan Goodhue, and I serve as the Manager of Advocacy and Community Engagement at Parents Helping Parents. As you review the LHA, I want to emphasize the importance of recognizing the school-to-prison pipeline and how it disproportionately impacts youth at the intersection of disability and race, particularly Latino students with disabilities. Data from the Santa Clara County Juvenile Hall Inspection Report for the Osborne School found that 85% of incarcerated students have an IEP or a 504 plan. That is 28 out of 33 students. Many of these youth entered the system already academically disengaged, often with outdated or poorly implemented special education plans. National data mirrors this pattern. A 2025 report from the Prison Policy Initiative found that more than 2/3 of confined youth are neurodivergent. For example, 60% of youth in custody have ADHD compared to 11% of youth nationally, and 27% have learning disabilities compared to 8% nationally. You can reference this data along with links to the sources in the comment letter we submitted to the Board of Supervisors yesterday. These numbers make clear that disability cannot be separated from our conversations about racial equity and Latino health. Latino youth with disabilities are far too often pushed out of classrooms and into systems of punishment rather than receiving the educational supports that they are legally entitled to. I would like to thank the Santa Clara County Public Health Department for meeting with us to discuss the school to prison pipeline and its impact on youth with disabilities. We appreciate the opportunity to collaborate and look forward to using this data, as well as addressing the still unmet need for real local data on the intersectionality of race and disability for Latino youth. Thank you.
Thank you.
We'll move to our Zoom speakers now. Our first speaker is Michelle M.
Hello again. My name is Michelle Mashburn. I am speaking for myself as a disabled advocate in Santa Clara County. You've made progress, and I greatly appreciate the progress that has been made with the Latino health assessment in including certain parameters of disability within that experience. And it's essential that we measure these things, but yet when I go into the content and the data that's presented, there is some data that is outdated pertaining to disability now being considered a minority population impacted by health disparities. So that designation has happened, whereas your report still uses a report from, I think, 2013, whereas in 2023, that declaration happened. The other thing is that Santa Clara County is also behind the times with the framing of the school to prison pipeline. The better phrasing and terminology of that is the school to prison nexus, because there are more than just school variables, but more about the societal oppression variables that come with the social identity of disability that creates a perfect storm to move these young adults into an incarcerated situation and setting. And this language is newer, it's more cutting edge. This is what Santa Clara County has promised to be, is to present that data and that information and to be on the edge of promoting disability equity in all that you do. Again, I thank you all for the hard work. I know it's been a process to get this data included. I'd also just like to amplify that we have adults with disabilities that are not measured in any way, shape, or form, and it's very underrepresented in this health assessment. I appreciate everybody's time. Have a good day.
Thank you. And our final speaker who raised their hand before the queue was closed is Saul Ramos.
Good morning, Board of Supervisors. Saul Ramos, Co-Executive Director with Somos Mayfair. For nearly 30 years, Somos has been doing the steady work of prevention, trust building, promotora and youth development in East San Jose. And as you review the Latino health assessment, I ask that you consider and look for opportunities that build on what already exists in our community. So we need your support. We need a coordinated effort to evolve and sustain a promotor model, to lift up the values that the Community Health Worker Promotora Steering Committee has helped elevate, and you'll see that throughout the report. But definitely to invest in youth-centered community development, including an opportunity that we have in reestablishing the MOXA Center. And as well, I do want to elevate the need to prioritize prevention and intervention with families, with children, with youth, and disabilities as well. Lastly, I want to offer that East San Jose offers important lessons about what works. The question now is, how do we invest in that trusted infrastructure that we've been building over time and scale those lessons into other communities, including a potential very deep partnership with Sound County as well. So thank you so much for the effort, and I'm looking forward to increased partnership opportunities.
Thank you. That concludes public comment.
All right, thank you. And let's go ahead and close the public speaking portion. I have Vice President Renes. Your light's on. Go ahead.
Thank you so much. I just want to thank those folks who called in and expressed their continued concerns and support for this item. I know that there's a lot of work to be done, and I appreciate everybody who is participating. And I can see the cross section here as you're all sitting in different departments and still working together, which I truly, truly appreciate. And I have to continue my gaze over to the other side of the well because there's a lot of collaboration. This is ultimately, for me, what I'm really hoping that we do is to have system integration and collaboration in a way that is effective. And as we're heading to a reduction, a huge reduction in our services, we have to be careful about the way that we also reduce our programs and services so that we don't inadvertently create more need and really the work that you're doing now is addressing some of the gaps and some of the maybe inconsiderate or even racist policies that other policymakers have implemented in the past, and to no fault of your or ours, but this is how the systems sometimes work. And I think in maybe in good faith, some policymakers have implemented strategies or policies that they didn't realize were going to create these kinds of inequities. And so it's up to us to really be upstream about what we are hoping to accomplish and to look at the kind of outcomes that we'd like, as well as ensure that we are not inadvertently creating more need in our community. And I'll give you an example of something that I came across when I first started as a council member for the city of San Jose. We were looking at community centers, and in the city of San Jose, we have roughly about 45 community centers throughout the city of San Jose. We ran 11 of them. And that's because during the Great Recession, we had to make sure that we closed some of the community centers. There just wasn't enough money. And so the way that the community centers were chosen to determine which ones were going to remain open were based on how can we have cost recovery for our programs and services. And so those that remained open, unfortunately, are in places where people can afford them and where people are actually paying for some of those classes. And so then that inadvertently created a lack of programs and services and classes for our communities that may really need them. And the way that we supported them were through some of these community centers, events, activities, classes that might have had some scholarships connected to them. And so we had to take a look at how did we do this and how do we undo what we thought in good faith was trying to save our community centers, right? And so in that same lesson of trying to do the best and trying to reduce our cost, I ask you as the folks who are really working behind the scenes to create some of what we're asking for as part of the report in response to the report, that we not inadvertently create the same thing, right? And keep the doors open only in the areas that can actually maybe create some reimbursement, Medi-Cal reimbursement, that you take a look at what the program services and activities that are really going to make a difference in generations. And that is, anyways, this is the reason I'm saying all of this is because we are heading into really difficult times, and some of these program services and activities that are not mandated by the state or by the federal government are really easy to fall off our ledgers because we are trying to stick to what is actually needed. But when we take a look at this population and what we already know from the Latino Health Assessment is that this population is in dire need. And the end result and the way that we see the needs are not only throughout the whole, and thank you so much to our leaders in public health for taking on that challenge and for making sure that you reflected the community as it is, and also added, per my request, the utilization of county services, which is not something that's typically for public health report. But you did it, no less. And what we realized is in our systems, we collect information very differently. Every department, every program, everybody collects. So then it tells us we need to also adhere to data collection formulas that make sense for us, because at one point or another, we are going to need to prove how our systems or departments across the whole system actually work with one another, work off of each other, and actually prevent in this idea of creating upstream strategies that we are doing that ourselves systematically. And so there's lots really waging here on your shoulders to prove to everybody else. And so we're starting with the folks I think that are really at the lowest rung of the ladder in terms of what is needed. And it brings me no joy to say that it's Latinos. So I'm going to start with some of the some of the domains. I'm going to start with the domains, and this is I'm going to start with the dismantling historical discrimination and marginalization. I want to thank Parents Helping Parents for their insight and their letter that they shared with all of us, all of the board, and really bringing to light the disabilities that overlay some of the difficulties that lead to the school to prison pipeline for a lot of our Latinos. And I heard it loud and clear. Nearly 1 in 5 Latinos and African American students in this county have a documented disability. That's 1 in 5. That means that 1 in 5 will probably not get support, be called out on behavior, will exacerbate their situation within the classroom, will then discourage them from committing to further studies, and then being distracted in class, which may lead to an absence. And some of that we're already seeing with the chronic absenteeism throughout all of our school districts and the higher expulsion and suspension rates, as well as the higher enrollment in continuation schools throughout our county. Well, let me just be specific, not throughout all of our county, through some parts of our county. So I really want to appreciate our public health for integrating a lot of what we understand to be true about disabilities. And sometimes I think what we don't see is our children who have the kind of disabilities that are either dyslexia or ADD, they are not as valid as some of the physical disabilities that we can see and that actually teachers can understand and be compassionate around. And so to me, it's making sure that we figure out what kind of work that we need to do. So the first thing that I want to ask is, how can we integrate the dismantling of the discrimination and marginalization of the disability community through our school-county collaborative, which is something that I had asked for in the last memo. Who can speak to that? Oh, you're so lucky. The first question.
Hello, supervisors. Heidi Emberling, Director of the Office of Children and Families Policy. So in terms of the County Schools Collaborative, these issues that you are addressing have certainly arisen. We have only convened for an initial conversation, but as we move into future meetings, I think the overall frame of the issue that came up most in the first conversation was the chronic absenteeism that you alluded to just now in your comments. And I think as we begin to dive into what that looks like, we're going to find a lot of potential underlying issues that lead to chronic absenteeism. And we're keeping in mind this frame, and certainly the frame that you've outlined here today at the forefront of those conversations.
Okay, and is there any, all right, I understand. We just have had one meeting. We're going to get started on this, and I appreciate you moving that forward. I want to make sure that we hear loud and clear the disability aspect, and I know that that there's additional information that we have integrated, and thank you so much, Rhonda, for doing that work. And for continuing to listen to our disability advocates and recognizing that we didn't get it right? And we're not always going to get it right the first time, but we're correcting it and trying to really move this forward. So I really appreciate it. One of the things that was interlaced with the disability community and their needs is the school to prison pipeline that ends up, that I just kind of talked about, and I oversimplified it, but one of the requests in the letter from public health, PHP, was for us to ensure that we had robust local data, and then in ensuring that we continue to find solutions for mental health services, as well as acknowledging that there is a disengagement, that the driver of disengagement is for our kids is disabilities, such as ADD and dyslexia and many others that are included. So I want to just make sure that we go ahead and maybe offline we can talk about this, and that and maybe this is what I'll ask, because there's a lot of questions that I have, but what I would love is the questions that I have here, we may not all go through with them today as thoroughly as I would like, because it is only 11 a.m., but it may take me the rest of the time, but my colleagues may not be happy with me. So I would love to have a follow-up meeting that has a cross-department effort and strategy, so that we can talk about the plan, everybody in one place, and I'd like to participate in a discussion. I love how you have this work plan under the 4 domains. It really speaks to being very thorough about all of the needs of the Latino community as we saw them in the report. And one of the reasons why we have some of these reports and the response to some of these reports, we have seen what AXA is now building out for the African American community, and what has already been built out for the Vietnamese American community. And I want the same for the Latino community, is to have a system built out for them. And it doesn't necessarily have to be a building, although in South County there is a need for, and already is present in a lot of the material. And there is some deserts, some clinic deserts that are in Mount Pleasant area, and certainly in the east side of San Jose, although with our purchase of regional hospital, I think that might address some of that as well. And so I want us to be able to have this larger goal of ensuring that we are, even though we are in very difficult times, that we are going to do the impossible to address the needs of the Latinos who are really overwhelmingly and disproportionately representing a lot of utilization and need in our systems. Okay, so I am going to move on, and this is moving on to prioritizing mental health and well-being. So this is key updates by domain. One of the areas that I have enormous concerns about is, and I've already said this previously, is the reduction in behavioral health services. And I see that happening over in, I participated in the Juvenile Justice Coordinating Committee, and there's also reductions happening in the juvenile justice system. The reductions are happening here in our behavioral health systems, and that's probably a domino effect. And some of the very few things that we do that are interrelated to the schools and directly with our children are the school link services programs. I know that there is, I read the number of students that were reached and that successfully connected to additional resources. What I would like to know is how many children are we actually connecting with the 40 Spanish-speaking clinicians? And how are we aligning the strategies in each individual school to address what we know to be true here as part of this effort? Because the schools are deciding what it is that they want to do based on what their needs are, but their data might be very different from our data. So how are we creating that alignment?
Thank you, Vice President. Megan Wheelahan. I'm going to introduce Catherine Aspiris, our Division Director, to answer your second question. On the first question, how many students were connected to those Spanish-speaking clinicians? I don't have that data at my fingertips, but we can easily get it, so I'll make sure we do that.
Thank you. I appreciate that. What I'm looking for is more than just we can continue to fund schools, and they may have a school fair one day and distribute 500 brochures that eventually go into the recycling, if we're lucky, maybe in the trash. And that means we made 500 contacts with students. That to me is very superficial and not the kind of strategy that really is meaningful that I'd like to invest in. And so I'd love to hear a little bit more.
Good morning, Supervisors. I'm Catherine Aspiris, a Division Director with Behavioral Health overseeing the school-based services. So in parts of your second question related to the data alignment, Behavioral Health has partnered with the 28 school districts that we have schooling services coordinators with, and we do have a data sharing agreement with the school districts, excuse me, where we collect data information on the referrals, the demographics of the students, the referral linkage, and a successful or the linkage and outcomes of the referrals. We also are collecting information related to the activities and the purposes of family engagement activities that's hosted and facilitated by the schooling services coordinator. We have shared some data with school districts related to chronic absenteeism and as well as office disciplinary referrals, and utilizing that information to proactively identify resources and supports for families. This has been part of the campus collaborative that schooling services coordinators coordinate, where they hear from the students, families, faculty, among the trends and the needs of the students in the schools, and then identify and develop family engagement activities. Between our school-based behavioral health providers and our school districts where we have services on, there is also information sharing dependent on the consent, but there is information sharing on the progress of services and supports for the students as they're going through treatment.
I appreciate that, and I'm not trying to be a Debbie Downer here, but I'm going to talk about the child death report that came out and covers years 21, 22, and 23. And as you see through some of those deaths, there's an increase over a little bit of an increase, and then it lowers, and then it increases again over those 3 years. And the suicide modality that was primarily utilized was hangings, and the children who were involved were as young as 12. Included in that was a kiddo, a transgender child that succumbed to bullying. Another one was a combination of a hanging and an overdose, and that is a sexual assault survivor who was also part of our system. And this, to me, I bring this up because I don't know if some of this information actually gets to our schools. I'm sure our schools understand who they've lost over the years, but I don't know who keeps track of those trends. And so I'd like to see us integrate the information from that data report more proactively. Actually, the board hasn't, I don't think you ever heard the report before. So I will ask as part of the motion, I'll make a motion in just a bit to ask for that death child report to return to the board and actually be heard by the board. But what I'm hoping to do today is really connect those dots. When you look at some of those cases, and there's deeper dives on some of those cases, and by the way, the committee that looks at all of these deaths are made up of all of the departments that are sitting here with us and with some additional outside stakeholders. And one of the things that they did really differently was that they integrated the adverse childhood experiences ratings into each of those children to rate what they were going through. And this is their way of trying to figure out what were they going through before that death happened, and to see some of the circumstances that contributed, right? So there is another piece that I would love to continue to explore, and Ana Lilia, I apologize if I didn't mention this to you previously. I know we had a meeting, but this adverse childhood experiences is something that I'd love for us to continue to explore. And how do we connect what we are doing in terms of mitigating those adverse childhood experiences? Because in a way, indirectly or indirectly, we're all trying to do that. If we are the safety net service provider for our children and our youth and our families, in one way or another, we are trying to mitigate for that, right? Some a little more direct than others. And I'd love to see how we can standardize the utilization of that. And I know Wendy isn't here today, but I know maybe through Greta we could figure out how to continue to do some of that. I thought it was really poignant of the committee to look at the adverse childhood experiences for some of these kiddos, to tell us more and to tell us the story, and to connect the dots. And some of the dots that I connected through that report were that there is some of those children have traversed systems that started as a child welfare system, and one of the elements that is very unfortunate is that some of these children suffered from neglect, and neglect is very difficult to maybe substantiate or to see, because it doesn't leave a bruise in the same way that maybe corporal punishment does. But neither does sexual abuse, right? You don't actually see it. I mean, you may see some of the after effects of maybe over-sexualizing play, or other elements that can allow for some of the caregivers or teachers in that child's life to indicate to them that they might have been abused. But neglect is just really hard, and so there was this common thread of neglect, and one, we have to recognize what we can do better, especially in our DFCS system, that if we didn't substantiate neglect in the lives of those children, but shortly after the loss of life, there was a substantiation of neglect or abuse enough that removed the surviving siblings of those children. And so I just encourage you to read the report, to take maybe some of those, the lessons and that those children are providing us in the ultimate, I think, failure for system is the death of those children. And so we've got a lot to glean from in order to provide better services. And so when we have this meeting, and I'll make a motion to accept the report and to ask for a cross-department, and just like how you are organized today, to discuss the 4 domains and the death report, the child death report, review report, and then I'll add to that motion as I move forward in my comments. But that is one of the things that I unfortunately we learn after the fact, but it is our opportunity to really take those lessons and be able to implement them so that we can help other children. Okay, and then what I'm going to do is also add to my motion to incorporate disability needs and stakeholders into future planning for the School Link Services Program, the county schools collaborative work, and the LHA action plan items that are designed to support school-based mental health programs.
Do we have a second?
Thank you. Appreciate that second. And then I'll step into before I leave that, there's so much that we can do, especially around social media and suicide prevention, that I think still remains a gap that we can help fill. And we don't have to, like, public health doesn't have to be the social media, or, you know, Anna Lydia, your team doesn't have to be the social media geniuses that some influencers are. We can actually contract with some of those folks to help us build our message. We build our message, and they help us relay the message out to other folks. I just, there's always never no coincidences in life. I always think universe brings me things that I need to learn about. And just yesterday, a young person sent me something through, and I'm not even sure if it's Instagram or one of the social media platforms. I'm not trying to encourage any one of those. But they talked about this orange slice. And this orange slice is a orange slice that a mom and a teenage girl would share. Even when she was young, she would, you know, the mom would try to cheer her up by bringing a little orange slice, and that would cheer up this little girl. And throughout her adolescence, it became harder to kind of cheer her up until she came across a breakup that really broke her, and stayed in bed for a really long time. And this orange slice was brought back, this idea of this orange slice for her mom to request for her to eat another orange with her tomorrow. And, you know, of course, very poignantly, this story is that it keeps this girl from keeping to her plans of a suicide, and it was obviously told much different and much more clear than I'm telling you now, but it was a story that was just outlined by another young person who's 16, who sent it to me, and I thought, you know, I can't, one, ignore that the reason why maybe this person is looking at social media like this or has come across it, and you have to ask yourself, how do we play a part in social media and influencing others, and how do we do that in our personal lives as well as in here as a county? And I think that we have really missed the boat in terms of, at least I don't know that every department uses it to its the fullest capacity that we can. and others are, either utilizing it for products and merch and what have you. And I think we need to take lessons from that as well. So anyways, I'll share it with folks once I end my comments. But the other item that I wanted to talk about, and this is now under prioritizing mental health and well-being. If it wasn't clear, I moved to that domain of prioritizing mental health and well-being. We talked a little bit about schooling services, and thank you so much for your response and support on that. I'd also like to see if there's any way that we can incorporate culturally appropriate workshops and topics for students and families that talk about the needs of their children who might have needs and maybe our parents don't recognize, right? And it's hard for a parent to say, oh, my child has ADD or dyslexia or any other learning disability because maybe we are just not able to cope with that. And so I wonder if there's any way that we can have topics that incorporate maybe public PHP. And I know they do this quite a bit for First Five, but this is for parents with children under the age of 6, where they talk about IEPs for individualized educational plans, how to accomplish them, how to advocate for them, how to make sure that they are enforced, and parental and student rights. And I'm sure that there's already a lot that has been done in this respect, especially under schools. I'm not telling you anything new, but I think that we need to figure out how do we connect the dots between children who may have disabilities and the potential of them falling into a school-to-prison pipeline. And I don't mean to say that to parents, as a way to scare them, but if we don't provide tutoring, if we don't provide support for these kiddos, these are the possibilities. And I think that there also needs to be a campaign for the parents in the same social media platform. As parents, we are also hooked to our screens a little more than we used to be. And we also receive information and memes and stories and whatnot this way. And so I'd love to see how we can incorporate a social media campaign for parents around disability rights and kind of know how to navigate resources. And I'll leave that as part of that's already in the motion. The other item that I thought was really interesting, and this, I'm going to jump into item 4, domain number 4, which is providing opportunities for children and youth to succeed, and I'll go back to the other one. Is that there was some information around housing, the housing study that was, I think it was released yesterday, right, the report? Ana Lilia Aranda?
Supervisor Arenas, are you talking about the literature review on the health effects of overcrowding?
Absolutely, that's exactly what I was talking about. That literature review gave us kind of snippets of, obviously, that's what a literature review does, is gives us snippets of data that can be found in different studies, and some of the ones that I just thought were really overwhelming. We anecdotally already knew this, and this is something that I was working at with gender-based violence, where I was a council member. And I understood that overcrowding, what overcrowding does, and I asked for it in our last memo. And I just want to say this because we did see that overcrowding does lead to a higher incidence of sexual abuse. It also leads to higher incidence of very severe physical punishment and abuse by parents or caregivers, a delay in gross motor skills. And this is something that I had actually really witnessed myself in the clinics as we were providing assessments when I worked under First Five, that a lot of our families who lived in one room couldn't do a switch. They couldn't do toilet training because they didn't have access to the toilet any time that child needed to go, right? And so how do you toilet train if you don't have access to a toilet? And so I would see kiddos who were 4 or 5 that were still using a diaper. And, no fault of their own, this is circumstance this is a circumstance of poverty, and not necessarily because that parent wasn't caring for those children, didn't want them to advance in their development. They just didn't have the resources to be able to do that. And so there's so much that tells us how Latino children are developing at a slower pace than everybody else, even in the most basic ways, which is gross motor skills, right? Which is also toilet training skills. And these are basic things that we may not think that we're competing with other counterparts, that we're all getting toilet trained at the same rate. And so this overcrowding element is really, to me, alarming, and just part of the problem that we understand it to be. Obviously, we've lost a lot of families, and a lot of school districts, especially in the East Side, are closing schools as we know them. And some of them are schools that have been around for a really long time, dual immersion schools that people actually are on a wait list, and those are closing. So, if there's anything that anybody wanted to add around that housing literature review, would love to hear from you now. Thank you, Dr. Rudman.
Thank you, Vice President Arenas. I think, we offer the full report, even framing just as you've said, that this lends a scientific view to match exactly what we've been hearing from community members, from childhood development experts, from housing and health experts, but most importantly, from the folks who are living in the conditions described here. And so it's certainly our hope that this supplement to what the Latino Health Assessment teaches us about our Latino community members' housing opportunities and environments can drive exactly the kinds of policies, shifts, and supports that folks need to change both the housing environments themselves and then mitigate the health threats. I'm happy to take any questions about the report.
Thank you. And I say to my colleagues, even though you may not have maybe an overwhelming number of Latinos in your community, they're still everywhere, right? We live everywhere. We live in Mountain View. We live in Cadillac. We live everywhere. And sometimes what we do is we create our own affordable housing options, which means overcrowding, right? And so like my district, my former district that I represented for the city of San Jose, which is District 8, we had two affordable housing sites. 2, that's it. And the rest were naturally occurring, which was single-family homes that were created into like apartment style, right? So there were a room for each of the families. This in and of itself just creates a lot of issues, and so I want what we know and we understand how this impacts children and families and how it contributes to crime, and how there's 2 pipelines here. One is the school to prison pipeline that we talk about that is more commonly known. This is, and I outlined some, not exactly the process, but more or less the process that our kiddos and Latinos and African Americans certainly are overrepresented in that school to prison pipeline, probably even a higher rate than Latinos are as well for the number of the percentage of the population in this county. But as I go back to the housing piece, I'm sorry, to the pipeline piece, there's another pipeline, and this is the sexual abuse pipeline that we know that when is left untreated and primarily impacts young girls, although it's not exclusive to young girls, that that leads to, and research shows that it leads to an additional sexual assault at some point in that person's life, either as a child or as a young person, and then can lead them to a relationship that is involved, that is a domestic violent relationship or in sex trafficking or in sex work. And so this is the other pipeline that I want to make sure that we connect into the housing piece, that we connect all these dots, because and our juvenile justice system is doing a really amazing job of not incarcerating our young girls, but we also have to take a look at how is it that they are being supported, because if they're not touching our system, where is the support that they're getting, right? So I'm going to add to my motion. So this is to refer the overcrowded housing memo, the literature review that we just discussed, to the community plan to end homelessness process and convene stakeholders to include a section in the community plan on coordinated planning related to overcrowding and McKinney-Vento definition of homeless children. In that, I want to make sure that we recognize the overcrowding connection with the crimes that I discussed, and that sexual abuse pipeline that we need to elevate and talk more openly about.
Acceptable to the second. Curtis, are you clear on the motion?
I believe I have the motion as a couple parts to receive the report, ask for a cross-departmental meeting to discuss the 4 domains and the child death review team report, incorporate disability needs, stakeholders into future planning for schooling services programs, schools collaborative, Latino health assessment action plan, and then to refer the overcrowded housing memo that we were just discussing to the community plan to end homelessness process. There was a little piece there that I was just trying to process when I got asked the question.
Yeah, that's really good, Curtis.
I thought so too.
That's very good. And I don't know if I heard you correctly when I said incorporate the disability needs and stakeholders into future planning for the schooling services program, the county schools collaborative work, and LHA action plan items that are designed to support school-based mental health programs. I can send that to you as well if you'd like.
That'd be great.
Great. Thank you. I got a motion. I got a second.
Perfect.
And I see the light from Supervisor Ellenberg. You've been most patient. Thank you.
Thank you very much. Supervisor Arenas, thank you for your continued leadership and advocacy for our county's Latino community. And as you say, wherever and everywhere they are. Thank you as well to the administration and all the departments that are here today for this comprehensive overview of the ways in which we serve our county's Latino community, including ways that we're continuing to grow as an organization to serve our residents better. I'm always appreciative when I hear a mindset of continuous growth, continuous improvement, and always want, and this is really true broadly, not just for this report, I always want folks to have the courage and confidence to say, this thing isn't working. We need to shift the funding. We need to shift the program. We need to do something different and better. And speaking of some of them, I'm really encouraged by the creative solutions the Public Health Department is exploring and relating to, in regard to expanding community health workers, specifically in the Cadillac-Winchester neighborhood in my district. I'm going to focus on Cadillac-Winchester for a moment. We know from the report that Cadillac-Winchester is in need of significant community-aligned, place-based interventions. And as the county executive highlighted at our last meeting, is one of the 5 most impacted zip codes by gun violence in our county. And this is, again, to harken back to my previous comments, why I really, really deeply believe that a community violence prevention model that emphasizes health and wellness can break and prevent cycles of violence. And this is just my call out and offer to all of you. I would very much like my office to be involved as we think more about how to push into the Cadillac Winchester community with services, programs, supports. My team has really strong, trusted relationships in this community. It has long been a priority area for me in the district, so I want to appreciate what has come and look forward to partnering with any and all of you to focus more deeply there. Thank you so much.
Yes, Supervisor Abakoga?
Thank you, President Lee, and thank you so much for the presentation. I appreciate, in particular, the inclusion of the overcrowded housing study. And I just had a question regarding that. And actually, I'm not sure if KJ is here, but as we look at the plan to end homelessness, I was wondering how this element of overcrowding fits into our plan, because I can see it as a prevention, a opportunity for prevention of homelessness if we're able to, address this issue of overcrowding. Reading the report, it talks about things like rental assistance and affordable housing as opportunities to reduce overcrowdedness, but also that there seems to be a tie into homelessness prevention.
Thank you, Supervisor. KJ Kaminsky, Director for the Office of Supportive Housing. Yeah, you're exactly right. I think prevention is one of the interventions that would be available for folks in overcrowded situations if they are in unsafe situations or have to leave their current housing situation. That prevention would be a potential a program that would help them, and so that would be where it would show up in the community plan. Certainly, we will share the brief with the folks that are developing our steering committee, our working groups that are working on the community plan, so that they can incorporate it into the planning process.
Great. So when we look at like the number of unhoused, will we also see this category as there's a high possibility, or they're a high risk population? So how do we start to address the elements here, or the issues here, to prevent them from getting into homelessness? If that makes sense. I don't know if that makes sense, but they're not counted at this time as part of the, they're not part of the point in time count. They're not counted as because they're not, but there's a very high possibility of them becoming homeless because of their situation. So do we have that kind of category of these are folks that we need to also look out for?
Yes, correct. So they wouldn't be included in the counts of people experiencing homelessness currently, but certainly included in the population in our community that would include folks in overcrowded situations or severely rent burdened that may be at risk of homelessness.
And so that we do have that as part of the plan.
We, typically the plan is still in draft or still being drafted, but we typically do include sort of an intro that describes the housing crisis and homelessness situation in our community. So we can, I can take that back to the team to make sure they include some of the information describing those populations at risk of homelessness.
Okay, great, thank you.
Okay, yes, Vice President.
Thank you. I'd be remiss if I didn't actually mention the end of the line for some of our kids, which is part of the school to prison pipeline issue, which is, and this is our violence prevention domain, and I really appreciate Supervisor Ellenberg, you bringing this up. I was actually the one item the domain that I didn't speak on. And not because I didn't want to, but because I wanted to kind of leave that for last. We are seeing an increase in violence, and and in different segments of our population, this is also an area where it is very easily, some of the work that we're doing that it entails a lot of like multidisciplinary efforts and strategies to really fall off, right? Because it's expensive, because staff is now going to be doing 2 jobs and not 1, in an effort to be more effective or efficient in our own systems because of the reductions in our budget. Not to say that that's exactly what's going to happen to everybody sitting around this room. You already do 5 jobs. So I understand. Everybody's very, very overwhelmed, and what I'm going to ask for is that we ensure that we are going to be protective about the work that we have done so far. And Casey, thank you for coming up to the well. The work that is being done in South County, specifically with the South County Youth Task Force, is a very coordinated effort, and I know it takes some work to do. I want to make sure that we also learn from the task force and figure out what is actually working so that we can create some evidence-based or best practices that are part of the violence prevention plan that we'll hear in April.
Thank you, Vice President. Yes, in the report that's coming back in April, we can certainly highlight some of those evidence-based practices that we would like to see continue, and even with limited resources, given, I think, the depth and robust connections between various departments in South County, maybe even potentially expand to include better data collection, because I do agree with you, and I know this was brought up also by Supervisor Ellenberg, that it's incredibly important to ensure that the work that we're doing is both measured and also really demonstrating efficacy in the communities we're trying to serve.
Thank you. And you know, one of the ways that we actually prevent some of our kiddos from, because we have our own pipeline that we're responsible for, right? This is the DFCS. This begins with DFCS, and I'm not blaming everything on DFCS, but the children who are involved in that system that may not have gotten the services that they needed that we recognize we didn't do, and that's based on the investigation and report that was done by the Department of Social Services that indicated that we were not removing children that were in harm's way, that had risks, that were being abused, and we left them in their homes. And so that in and of itself creates a whole generation of children who might have learned that it's okay to be treated this way, that they are now trauma bonded with their own respective parents or caregivers, that cycle of violence will continue on. And this is important for our violence prevention plan because that's part of what we have contributed in terms of the generation. To not have removed, to not have protected, we created that. And so in our own systems, we'll see these children move from DFCS over to probation, right? And we'll see them in the DA's office eventually. And then we'll see them, unfortunately, in our jails. When we could have really, in our own, taken our own philosophy and logic, been really upstream and invested in them when they were in DFCS. Okay, so we didn't catch them there. Well, let's focus on them when they're in probation or in the community, when we still have an opportunity to really support those children and youth. Because what we're doing is allowing for that pipeline to continue to grow, and then we eventually see them all in the jails. And currently, our jail is absolutely not the place that people should be, not only because it's a punitive system, but it's because it doesn't have the kind of conditions that, I don't know if a jail can offer a dignified environment because it is a jail, but at the very least be in an environment that is respectful of the people who are living there, because that's exactly what they're doing. They're living there. And that also contributes to the health and well-being of those folks in that jail. And we saw last year how a gentleman who came into our jail system who had mental health issues was beaten to death, right? So in our own respective systems, we need to take accountability and responsibility and recognize the issues that our own pipeline feeds. And if we want to be and create, transformational systemic change, then we need to look at our own systems. And this is an opportunity to actually do this. It might say the Latino health assessment, this might be all about Latinos, but this is really about our systems and taking a really good analysis of how our systems are playing a part in the dynamic that we are creating in our own community. And so, I'd like to see how our, maybe a report back about the improvements and I know this falls under another committee, but I just would like to see it, how it plays a part here in the Latino health assessment. And I'd love to see how, I know we're going through a whole process to improve our jails, and I don't know where that is actually falling. And if we can get an update. Greta, is that something that we can do?
Yes, we're happy to provide that update. We have regular reports on all the jail reform efforts that go to public safety and justice. And I can't remember the date, but I can get back to you on when that next update on those reform efforts. And specifically, we can add a focus on some of the issues you've raised to that next regular update to the full board.
Perfect. I'd love to see that because I think that we have a captive audience in our jail system and that we have to do our part in order to really count this time as their incarcerated time as a time to rehabilitate. But if we don't offer substance abuse support in our jails, if we don't provide behavioral health in a way that meets the needs of the people in the population, if we don't improve the living conditions, then we are going to continue to see this pipeline get worse because our jails are just one step of the incarceral system. We have prisons that are worse, right? So I'm going to make that as part of my motion is to ask for an update on the jail improvement. I don't know, what do you call that? Sorry about that.
We have two separate reports that are regularly coming to Public Safety and Justice and to the full board. One related to our jail facility transformation, which, as you know, is the big barrier for us expanding some of the services that we're talking about. And then we also have a more holistic report on a whole array of jail reform efforts, some relating to our consent decrees, some relating to other non-consent decree driven reforms.
Yeah, those are the ones that we see on the regular. I'd like to see the transformation, the jail transformation plan connect to this LHA, and that Curtis is part of the motion. So, and if it's okay with the seconder to integrate.
I just want to check with Greta in terms of workload. That works okay?
Yes, and I'll just note that we have an update on the jail facility transformation process going to the Public Safety and Justice Committee on March 16th, and then the next full board update is in June, so we will include the response to this request in the June report to the full board.
Good. Okay, thank you.
Perfect. Thank you. And the last piece that I'm going to include, and I apologize if I didn't say this clearly, I think during our last memo that we had around this LHA, we were trying to be very subtle about the school system collaborative, but I'll spell this out more clearly. So it is very clear that the school to prison pipeline is part and parcel of the LHA. So I'm going to add to the motion as a critical step in supporting LHA action plan work to address the school to prison pipeline and reduce juvenile justice involvement for vulnerable youth, incorporated into the a work plan, a report back with options to prevent young people of color with disabilities from facing disproportionate rates of expulsion and other school disciplinary actions and overall school disengagement.
Yes.
Perfect. All right. Well, that ends my comments, but I do appreciate all of your work and this opportunity to have this conversation with all of you. I know for me, this is going to be for the community and the ethnic group that I belong to. This is transformational, I hope, because what we're hoping to do is create generational change and really look at the root causes of what we see in our school systems, in our streets, in our neighborhoods. The lack of, the graduation rate for Latinos, the suicide rate for Latinos, all of what we overwhelmingly see Latinos involved in has a root cause, and unfortunately, our systems sometimes contribute to those root causes. And I ask you to look at this in a very systemic, very strategic way, because I'm not asking you just to look at how can we improve a program, service, or activity for Latino community. I'm asking you to create generational change for the Latino community. So thank you.
Thank you. No further comments. Let's go take the vote.
And for the record, I believe that was a motion by Vice President Arenas and a second by President Lee. All right. Supervisor Abecoga.
Aye.
Supervisor Jung.
Yes.
Supervisor Ellenberg.
Yes.
Vice President Arenas.
Yes.
President Lee.
Aye as well.
Motion carries with 5.
Thank you. Then I believe we're moving to item number 14, which was held from September 16th regarding the adoption of the ordinance to amend the various sections regarding the district attorney's military equipment use policy. Good morning still. Let's try again, see if that mic works.
Good morning. Brian Welch with the District Attorney's Office.
Morning.
Good morning. Desiree Thompson.
Uh-huh.
Let's see if that's working. Desiree Thompson, I'm the captain of the Bureau of Investigation for the District Attorney's Office.
Thank you.
Good morning. I'm Nate Wanderer from the Department of Range Master.
Nope, that doesn't work. Let's try again.
How about now? There we go.
Yes.
Good morning. Nate Wanderer, Department of Range Master.
Uh-huh.
Roberto Navarro, Senior Criminal Investigator.
Yes, good morning. Yes, thank you. Do you have a report on this one?
I'm sorry, could you repeat that?
Do you have a staff report on this one, or we could just go straight
Yes,
to
thank you.
Good, sure.
So we're here required by state law to seek approval for the acquisition of what is defined under state law as military-type equipment. We initially submitted our annual report last September to cover the 24-25 reporting time period. I think as a testament to the value we place on the feedback we receive from various members of your staff, as a result of some of that feedback, we decided to withdraw the report and to substantially modify and enhance the information that we were providing and the rationale for the request. We also withdrew the report to correct one clerical error in terms of the way we categorize the acquisition of additional rifles. We would have liked to have been here sooner, but quite a few people were involved in pulling together the newest report and getting back on calendar. We did submit now the updated report laying out our request to acquire 10 additional rifles, as well as noise flash devices that are important to the work of the members of our Bureau. Hopefully the detailed report that we provided to the board answers all of your questions, but we're here today, of course, to field any questions any of you may have.
Thank you. All right, do we have any public who would like to speak on this item, Curtis?
I have no cards in chambers, and it looks like one hand raised on Zoom.
Okay, let's do 2 minutes for public.
Okay, we'll close the queue. Our speaker on Zoom is Parent.
Yes, I ask that the board vote no on this item, and that's because Jeff Rosen's temperament. I mean, he's incentivizing violence against me. He's covering up the sexual abuse of my kids. I mean, what are these extra rifles going to be used for? I mean, are they going to escort out of the office, help escort out of the office a deputy district attorney like Daniel Chung, who wanted to help protect me and my kids? I mean, it's absurd that they're asking for military equipment. Shouldn't they just be focusing on legal pads, pens, computers? I mean, it's just terrible what our district attorney's office is doing to our community. And now we're going to arm them with more AR-15s. I mean, they don't demonstrate any lack of any integrity, any morality, any ethics to be doing these type of really absurd and disgusting things to my family. And now we're going to give them more military equipment. It's terrible. Please, board, please vote no on this item. Thank you for your time.
Thank you. That concludes public comment.
Supervisor Ellenberg.
Thank you. I want to thank the department for clarifying the request that you're making today. I do recall that the incorrect military equipment use report was posted to the agenda when it was brought to the board in September, as well as initially for this meeting. So just to confirm, the department is declaring the intention to purchase an additional 10 AR-15 rifles and will not be replacing any of the current arsenal?
Correct. We have a current inventory of 20. We'd like that to be at 30.
Got it. Of course, it's critical that we are transparent about the status of current military equipment within the department's possession and clear on the justifications for their use. Just to do a quick review for the benefit of the public, in 2022, the Board of Supervisors' newly established military equipment use policy recognized that the DA's office included an arsenal of 10 AR-15s at that time. And you have 20, so additional rifles have been purchased since 2022, yes?
Correct.
With regard to, correct me if I'm mistaken, you had 10 when the military policy, when the use policy came into effect. You then purchased an additional 10, so that was up to 20. Did you replace any, have you replaced any of the AR-15s?
For that question, Supervisor Ellenberg, I'd like to defer to members of the panel to my left who are subject matter experts on that.
Great, thank you.
To address your question about replacement, yes, we did. We replaced the initial 10 rifles with 10 upgraded rifles.
Got it. And what was done with the non-upgraded rifles, the ones that you discarded?
They were traded in with a vendor.
So they weren't destroyed?
Honestly, ma'am, I can't answer that question. I don't know what happened after the vendor took possession of them. They paid the county the agreed upon trade-in cost, or trade-in value.
So walk me through that. Who is the vendor?
So our vendor, as I'm sure you're quite familiar, after we went through the acquisition process, the request went out to bid, and it was awarded to a company called ProForce. ProForce, as I understand it, contracts with a separate vendor to accept trade-in guns. Mm-hmm. And they claim the guns, they take possession of them, they are registered as no longer in possession of the County of Santa Clara, and then we lose track of what happens with them after that. We have no way of tracking that.
We have no way of tracking what happens to weapons that we take away from your arsenal. I would like to get some information about the vendor, and it would be good for you to know as well, to confirm that you don't have any concerns, to find out what that vendor does with the weapons. I had actually hoped the answer was going to be that they were destroyed.
And ma'am, they may have been. I don't know that.
Got it. I understand that from July of 2024 to June of 2025, the rifles were unused outside of a training environment. Certainly that's good news. When were the rifles last used for field operations or discharged outside of a training environment?
And we make it clear that using the rifle is discharging the rifle rather than being armed with the rifle during an investigative operation.
Great. So then separate them for me.
I don't
When
know
was
of
the
any
last-
occasion when a rifle has been actually discharged during an operation.
That's correct. We have not had the discharge of a rifle in an operation. The rifles during training are discharged at the Santa Clara County Sheriff's Office range for training exercises as well as qualifications. As far as field use, as far as their deployment and non-discharge, there is an operation running today in which they are in the field.
Okay. So to recap that then, for the last 3 years, the department has not discharged any AR-15 in the field.
Yes, ma'am.
Great. This updated military use report is directing or requesting or indicating the purchase of 10 new AR-15s to bring the total rifle count to 30. Why are you seeking to triple the number of AR-15s that we had as of 2022?
We've seen an expansion in the Bureau of Investigations from 2022 to present. Some of that expansion is the task forces, including the Human Trafficking Task Force and the Gun Violence Task Force. In the expansion of the Bureau of Investigation, which at present we have approximately between 90 and 100 investigators. Of those investigators, many are certified as rifle operators from their prior agencies, so it's a skill set that is within the Bureau of Investigations. It's a skill set we're not using because we don't have the equipment to utilize that skill set. So the request for the expansion is to maximize the skills that we have within the Bureau, as well as address the expansion and the risk, the inherent risk in being part of these task forces that comes with that. So kind of addressing the safety concerns that we have in doing operations like the Gun Violence Task Force participates in and our Human Trafficking Task Force. It is best practice in the profession to ensure that we become well-equipped to execute any kind of search warrants or violent moments or confrontations that we may face.
Do you face these potential high-risk situations alone as investigators or in tandem with law enforcement?
So the investigators are law enforcement. They are peace officers. A lot of our operations are done jointly with our neighboring law enforcement agencies, both state, local, and federal.
Are they ever done independently of any other enforcement agency?
Yes. They also are done independently. Some of our operations are done by our task force members or by our investigative teams, independent of a SWAT team per
Got
se.
it. But you're doing investigation as opposed to enforcement, correct?
So a lot of our investigations do lead to an enforcement component to it. So investigations and enforcement go hand in hand. If the investigation leads to the potential arrest of a subject, we will ensure that that occurs.
Do you perform the arrest, or
We
you
do.
call in a law enforcement, police department, or sheriff?
Yes, so we would execute the arrest of the individual.
So the district attorney's office has, you said 90 to 100 investigators, and those investigators have the power to arrest.
Yes, so we are all peace officers with powers of arrest. That is correct.
So it's really another police force in many ways.
It is very much designed like a Bureau of Investigations. I came from San Jose PD and served in the Bureau of Investigations there. Very similar in its ability.
Every BOI investigator, I believe you said, is issued a duty firearm. How many will be assigned AR-15s?
If we were to have a stock of 30, it would likely be approximately 28, and Nate, correct me if I'm wrong there. We anticipate not having them all issued. We want a few in reserve to address any kind of malfunctions or anything we need to address in the field.
Mm-hmm. I know that post requires that our sheriff deputies renew their perishable skill, which of course includes rifle handling every 2 years. How often are the recertification programs completed for your investigators?
Every 6 months.
Every 6 months, thank you. The department spends upwards of $30,000 a year on ammunition to be used for training and field operations. Last year it spent a little over $37,000, and it's anticipated the department will spend another $37,000 in the current fiscal 25-26. How many rounds of ammunition does the department maintain in the stockpile, and how is that amount and expense justified, again, given that these rifles are predominantly used in training, almost solely used in training?
The ammo supplies fluctuate is the most accurate answer. We do yearly acquisitions that are contingent upon availability. So it's not particularly easy for me to be accurate about a current ammo count, as they do fluctuate, and sometimes we wait 12 to 18 months for delivery. It has been as long as that in the past. But as you can see from the report, we do make annual acquisitions so that we have the ammunition on hand to perform our required training.
Yeah, honestly, nothing you've said demonstrates a compelling need to me. I understand that the dollar amount at issue today is not large in the context of our budget, but I can't, in good conscience, support the acquisition of additional firearms and ammunition at a time when the same department is proposing cuts to critical services such as victims of violent crimes. And I heard and appreciated the district attorney at his State of the Office speech query how much the life of a domestic violence victim is worth in Santa Clara County. And I would prefer to see, before the department directs any funding to the purchase of AR-15s that will not bring greater safety to our community. I would truly hope that this office prioritizes the budget to direct services that protect and heal victims of crime. Again, I understand that the amount is small. But there's no space in my head to see this as a priority. And I would look to my colleagues to encourage us to deny the request as truly unnecessary to the promotion of public safety in our county. We've talked a lot about public safety today, and where that happens. Clearly, this is a very, very robust and seemingly well-armed department, and I appreciate your answering my questions today. I would move that we deny the requested action today and hope for a second.
I'll do the second.
Thank you.
Motion seconded? Yes, to a second? Go ahead. You have comments?
Thank you. I appreciate this report, and I appreciate the deeper dive on and your questions, Supervisor Ellenberg. I was also very confused about the need of a higher amount of rifles in the district attorney's office. As you are, you said peace officers and investigators are doubled up as peace officers. Do you not already hold a handgun?
We do. The purpose of the handgun versus the rifle have two different roles. The rifle offers something that a handgun does not. And I think the best example I can give in which law enforcement was faced with this exact issue was in Los Angeles during the North Hollywood shootout. And in that moment, it was realized by the police in real time that they were facing an armed assailant who was, two as a matter of fact, who were wearing body armor and were armed with assault rifles at that time. The police, it changed law enforcement completely, that event, and realizing that our handguns alone were insufficient for what we were now facing in modern society. And so we saw a shift, and I can tell you with personal experience, having been in law enforcement for this long, I saw the shift in what used to be just carrying handguns to both having the option of a rifle and a handgun. And that is a significant difference. They do not do the same thing. They may operate similarly, but their deployment are for two different purposes.
Well, I do have to recognize we are far from North Hollywood, and we're even far from Oakland. And I'll tell you, my sister's always worked in Oakland as a police officer and an investigator. And so I have nothing against our police department having the kind of equipment that's going to protect our community. But there's a difference between the district attorney and a police department. You are not a police department. And so you are not the first responders to the kind of incident that you just illustrated, correct?
That is true. We are not responding to 911 calls. However, if an investigator were to, anything were to occur in this facility itself, or if we're walking in the parking lot, we are required to act and take action. The VTA shooting, for example, that was just down the street, if an investigator were to be present, parking their vehicle or what have you, we would be with the police department acting in that capacity, in the capacity in which we are trained to act.
Yes. No, I heard a lot of ifs in your statement, but that is not your primary role. Your primary role is as an investigator, and if it requires to enforce for enforcement, but you're not first enforcing and then investigating, correct?
Correct.
You're doing the opposite of that, and so I find it just difficult to understand why we would need additional rifles in the district attorney's office, being that we just participated in the gun buyback program, and then essentially the district attorney is doing their own buyback. And releasing rifles that were never even utilized to protect or to enforce the duties that you are obligated to do as investigators. And so for me, I'm scratching my head literally and figuratively. I don't understand. I seriously don't understand. You have a handgun. The rifles that you are asking for are within the police department's access and availability, and our police departments in our area, I know, are very well trained and can respond to the kind of incidents that you referred to. And so I don't understand why you would need anything additional to a handgun, which you already carry. You already carry a handgun. A rifle is something that I don't understand why you would need one. There is no incident that you are going to prepare for that you are going to then utilize in your investigations. You're going to respond to it, but I'm going to assume that it hasn't happened in 2 or 3 years. I don't know if we are just thinking that it's going to happen one day. I guess I'm not really sure what the real use of the military equipment is for the district attorney. I can see it for our police departments. I can see it for our sheriffs. They're the ones who are responding to these kinds of incidents. I just don't see the logic for the district attorney. So anyways, this is my explanation of the reason why I seconded this. Obviously, you're all in the office believing that you need these tools that you haven't used since we created the policy. And you're sending back guns into the system where we don't even know what is going to happen to them. That is another, it's there's a consternation there for me in terms of why. Anyways, I'll end my comments there. Thank you.
President Lee,
Yes,
if I might just
Council, please go ahead.
clarify the motion. So Supervisor Ellenberg, you spoke to the 10 additional rifles, but the report also includes ammunition, rifle accessories, flash devices, and other items. I just wanted to understand whether your motion is intended to cover each of those items or just the rifles.
I assume all of those things go together and are used together.
Okay,
so
and I just
it
wanted to
covers all
clarify
three.
the seconder's intent is aligned. Supervisor Arenas? Yes. Okay.
Yes.
Yes, Supervisor Bikuga?
Thank you. Just a point of clarification. Also, is the policy is also included in this? Is that right? The original item.
I'm sorry, can you clarify that question, Supervisor
So,
Bikuga?
where's, maybe I'm reading this wrong, but there was a military equipment use policy. Is that a part of this item as well?
Supervisor, I can speak to that. Per state law, these policies are required. State law is very prescriptive as to process, and it requires the policy be adopted by means of an ordinance. So the ordinance you see attached, that's not the process we would choose to use locally, but that is what constitutes the policy.
So the motion would not approve the policy? I'm sorry, could you clarify the motion?
I actually think you can clarify it
Yes, I
better than
understand
can.
the
It's
motion.
not about the policy. It's approving
the purchase.
You need a use policy to be able to make the purchases.
Okay, so the policy is already. I'm not impacting. Okay, so it's just about the purchase.
And to the extent the ordinance memorializes the adoption of a department level policy that then lists the items, there may be a need to amend the department level policy. I'm happy to look at that with the district attorney's office, if and when that's voted on.
Okay, all right, thank you. And if I guess I'll make
Please, go ahead.
remarks. Yes, so I appreciate this coming forward, and I appreciate that we had our many questions that the office answered in advance, and the policy was much more clear, and very much appreciate that. And I also wanted to thank you for incorporating community engagement into the policy. I actually will not be supporting the motion and supporting the original staff if staff recommendation if that comes forward. Learning how law enforcement and public safety works, how the DA's office works, often hand in hand with our sheriff's office as well as our police departments. I know that oftentimes our investigators will go out on calls hand in hand with our police departments. And there's a very tight collaborative working relationship that we have, which I very much value. And I've always felt that, and I've always supported that, folks in law enforcement have the tools that they need and the equipment that they need to be able to do their jobs, especially given the high risk that, and frankly, they oftentimes putting their own lives on the line. And so I see our DAs, investigators out there, right there with our police departments, and I would not want them to not have the same equipment that they would need to answer a call or to respond to an incident. A lot of these incidents happen, instantly. You don't obviously expect them. And, the hope is that these equipment items would not have to be used. But I guess for me, given that folks, are there and their lives can be at risk. I just want to make sure that they have what they need to be able to, respond to the incident and also be safe and protect themselves. And so, oftentimes when I look at public safety, both police and fire, or sheriff and fire, law enforcement and fire, it's really kind of having an insurance policy. And so I feel very strongly about making sure our personnel are equipped properly. And so I know we have a policy, again, as we saw at the last meeting, policies have to be adhered to and followed for things to be as foolproof as possible. But I trust that our folks, our department is able to do that. And so I will not be able to support this motion. Thank you.
Thank you. Oh, Vice President, go ahead.
Yeah, I just want to add one thing, and thank you for your comments, Supervisor Abacoga. I just want to emphasize that you said that you want to make sure that the law enforcement has the tools that they need. I also do. I also believe that our law enforcement should have the tools. I've said my sister's worked as a probation officer, police officer, investigator in sexual assault in the city of Oakland, not in San Jose, in Oakland. So I absolutely want her to have all of the tools available to her so she could carry out her work. But you are not law enforcement. There's a distinction here. The DA is not law enforcement. You are investigators, and we have already our police departments in place, our sheriff's office in place, that actually respond in a way that I think will help protect all of us. And so because I think it's not needed, you already carry guns to protect yourselves and to ensure that folks can comply in case they become violent. I don't know how you would distinguish between a gun and a rifle, and being that you haven't utilized it in the last couple of years, I'm going to say that there is no real need for that utilization because you're not law enforcement. You're peace officers that are completing investigations on behalf of our greatest prosecutor, who is our district attorney. And so I just want it to be very clear that I am very supportive of our law enforcement, and I want them to have the tools. I just don't see that the tools fit here. Thank you.
President Lee, I do have one further legal clarification from the mover and seconder. I apologize. The motion was to, if I understood correctly, deny the additional acquisitions, and Tony clarified with the mover that it was for all of the items that are listed, not limited to the 10 additional rifles. However, I did want to note there's an existing inventory of 20 rifles and associated accessories that are part of the existing approval. If the ordinance today is simply denied or not voted upon, the existing authority to use the equipment currently in the inventory would expire. So I want to clarify whether the motion includes denying the additional items, but what the intention is with respect to the existing inventory.
Thank you for that clarification. I had not thought that through. And while I would like to say no to all of it, I believe that that's kind of beyond my expertise and purview right now. Let me look to the seconder for conversation. Okay, we're focused on the acquisition of new at this time.
Thank you.
Thank you.
Okay, I do actually have questions here regarding the current motion and also the issue of the number of ammunition. So in addition to the not purchasing the additional requested ammunition, based on the current inventory, since the motion has basically made it clear that we're not touching the current inventory, without buying the additional 10 weapons, would that affect the training ammunition needed for the continuing ownership of those 20 rifles for our officers?
I want to make sure I understand the question.
Yes.
Mr. President. Are you asking, can I ask you to ask that question again?
Sure.
I'm sorry.
Yeah. So basically, there looks like there's really two parts in this proposal. One is talking about first, there's a current inventory of 20 rifles, and there's ammunition that's been purchased for the training for those 20 rifles. And in addition to that, there's the proposal of adding 10 additional rifles, also additional ammunition for that. And I believe there's also the other devices like the NFDs, the noise flash devices. Am I correct?
Yes.
Right. So it looks to me, and trying to clarify for everybody, the current motion is to leave the current inventory alone, the current ammunitions alone for training and whatnot, just not to approve the purchase of the 10 additional rifles, additional ammunition for those rifles, and also the NFDs.
And to adopt the ordinance with those changes.
Those changes, okay. I just want to make sure we are all clear what we are voting on today on this specific motion. Yes? Okay, all right. I think that's what I'm hearing. Yeah, so certainly, from where I'm at, I'm still perplexed with this. I think it's very true that the role of the district attorney and experienced investigators really is investigating the crime more than actually doing the law enforcement work, even though tangentially it would happen from time to time. The fact that you already have 20 rifles and the ammunitions, I think, is quite significant. And I don't believe we should decrease those numbers. I really think it's already inventory, and I think that the officers need to be trained. Having another additional 10, I think, is where is bothering me as well, given the fact that we really have those 20, and that has been used for training. And what we have been seeing is that we really have not seen the actual need on the field other than for training purposes, which is a good thing. We do have, of course, partner agencies. Our sheriff's department certainly have a separate military equipment use policy that is very detailed of what they have as well. And I certainly do believe that our officers work closely with our other agencies, including sheriff deputies and also the police officers, SJPD as well. So I'm a little bit perplexed why we really need those additional 10 rifles. And I would say maybe I just don't see the need as much. And if you can come back to explain to me better, I am not ready to vote for adding those 10 today. But at the same time, I do believe that those 20 and the current ammunition that's being existing is necessary, as you have currently. So I certainly do not want to change that. So based on those, I will be supporting the motion on the table right now. Is that clear, Tony?
Yes.
Okay, thank you. All right. So, John, you have any more, or I'm just going to take the vote? Okay. Yes, Curtis, go ahead.
Supervisor Abacoga.
Nay.
Supervisor Jung.
Yes.
Supervisor Ellenberg.
Yes.
Vice President Rennes.
Yes.
President Lee.
Aye as well. Thank you.
I believe that was 4-1.
Yes, thank you very much. Thank you for the report. Appreciate it. Okay. Moving on to the next item. We actually are moving fairly quickly today. Item 15 is the items that's removed from the consent calendar. So from what I see, I believe we have item 31 that was being removed, which is adopting the board policy resolution amending the board supervisors policy manual relating to the cap on budget inventory items here. And I believe this was pulled by Supervisor Abacoga. Go ahead. Yes.
Thank you, President Lee, and thank you for allowing me to pull this item off of the consent calendar. I pulled it because when we last talked about the inventory program about a month ago, we didn't have the actual inventory numbers, amounts that were calculated for this upcoming fiscal year based on the the changes we made to the program allocations. So now we have them, and looking at them, I just wanted to look at them and point out the large gaps between the allocations for each district. And I know we were trying to come up with a new allocation method from the dais, which isn't always very helpful or a good way of doing things. And so I wanted to ask for your indulgence in revisiting the conversation before we formalize it in the policy manual. As was mentioned by my colleagues at our last deliberation, all of our districts have needs, and all of our districts have needs that we try to address through the inventory process. So we know that this need is not always captured in the Medi-Cal numbers, which was used as part of the trying to provide an equity piece to the formula or the allocations. But looking at the numbers, I didn't want to leave any community behind. And why I say that is that through the inventory process last year for District 5, we were able to serve residents in an unincorporated area of the county through a food service organization. And these are residents who are hidden throughout the Santa Cruz Mountains and the rugged parts of the mountains where there's no transit, no health centers, no community kitchens, no food pantries. And so I met with the grantee this week who had asked to just come and meet and let me know what they were able to do with the inventory grant. And they were able to purchase one vehicle to distribute food. And that completely changed his ability to serve the residents and really changed the lives of those residents. And you know, he was very grateful, saying that it wouldn't have been possible through any other means. So I feel that I have to do my due diligence for my constituents by respectfully asking your reconsideration of the allocation methodology, and at least try to have a little bit more of a balanced approach. And so I wanted to bring back an idea that President Lee brought up in our last discussion, which is on the sheet. So this would be reducing last year's allocation. And that's what I realized was last year we had a portion of the allocation that was, $1 million per office, and then the other $2 million was divided by equity, the equity or the Medi-Cal numbers. And this time it was just straight equity. And I guess I was thinking we would be doing what we did last year, but rookie move on my part. And so President Lee's suggestion was just to reduce last year's amounts by $500,000 each, or $500,000. I'm sorry, that's right, yeah, $500,000 each. That would amount to another savings of about $500,000. I know there was interest in, saving or returning back more money to the general fund. So now looking at these numbers, I thought that that idea would be a better way to approach this. So just wanted to, I guess I'll make that motion, see if anyone would be willing to second that change. Or I'm also open to other ideas. Thank you.
First of all, thank you so much, Vice President. I think a lot of us didn't really see the real numbers, so now that we saw the real numbers, and obviously I appreciate you liking my motion earlier, but now that the print is already in ink, and I think there's people who have looked at these numbers, I think trying to get our colleague to agree to reducing these numbers is going to be very difficult. If there's one of our colleagues willing to second it, I'll be willing to vote yes to move forward, but I'm just going to see if there's anybody else, because otherwise if we don't have that, then I don't believe it would even pass. Yes, Vice President Arenas.
I just want to speak to this because this is
Sure, please.
This creating more a balanced approach is what got us into this mess to begin with. And I'll tell you, my district, even though I have 20.19 shared of Medi-Cal enrollees. It doesn't truly reflect the needs of my community because my community has been underserved for generations. And so how do you create balance to a district that has been, through generations, overlooked, underserved? And this doesn't even do it justice. I would ask for my district to actually receive more than what I'm allotted because it doesn't take into account historical inequities of underservice. And throughout the 12 years that my predecessor served, he took no part in inventory grants, which is also reflective of the underserving of that specific community. And while the votes don't come from South County, that is not what guides me. And the needs of my community guides me. And so I kind of contest the Medi-Cal enrollees because I don't think that it really takes into account the kind of underserving that my community has. For example, and I'm sorry to use your district as your community supervisor, Young, but there's been also historically underserving in your district in the East Side. I grew up in the East Side. We both grew up in the East Side. But there has been a turnaround in the East Side in terms of services. There's agencies that serve there. There's folks. There's a lot of collaboration, and there's different groups that actually serve the East Side in a way that I think is very different than what they did when I was growing up. When I was young, I was doing the surveys at Mayfair Initiative. It was called Mayfair Initiative before it was called Somos Mayfair, and I was working for the city of San Jose. And actually, I went door to door and got the feedback that eventually created some of what Somos Mayfair is now. So I know the difference. I know what has been served in the East Side and what isn't now. And the sad thing for my district is that Gilroy continues to have the same lack of services to the point where in a data point of sexual abuse out of, I'm going to be conservative and say 300, but I think it was 300 plus. There was 300 sexual abuse incidents, and of those incidents, only 14 people, all from South County, used a child advocacy center that is in San Jose. That is a struggle for sexual abuse survivors and their families to get to San Jose because of the distance, because of the poverty and the generational lack of investment in my district. And we still don't have a child advocacy center. We're providing vouchers for them to get to San Jose. So I'm trying to really rectify the things of the past in the way that I think your predecessor, Supervisor Young, did for the east side of San Jose, right, in her capacity as a supervisor. I am not prone to reallocate. I understand the concept of equity, and as a former council member in District 8, there is 3 country clubs in my district. I received one of the lesser amounts when we had this concept applied at a council level. I understood that, and I still advocated for it, and I still voted for it, even though I knew my community was going to get less. I understand because in the greater concept of it, the east side of San Jose, 7 Trees in District 7 had more issues. Even downtown District 3 had more incidents and more issues than my district did. And so I think this is I think what we need is an actual conversation around equity and how we apply it and how we would like to apply it. For the moment, I think we need to just move ahead in terms of what this inventory budget is, and as we move forward after the budget, we can figure out what that is, what that formula actually is. And I'm happy to pick it up because I think Supervisor Ellenberg and I had an ad hoc meetings, we met ad hoc to actually discuss some of this, and we were waiting for everybody to come back into, to have their permanent spot because we knew people were leaving. I just don't know that I'm going to subscribe to the concept of a balanced approach because equity is not balanced.
If I could respond to
Yeah,
that, I understand that, and I wasn't saying balanced like completely, but there's a huge difference, and I was just asking for consideration for, a reducing of that gap, and this is just one program in our entire offering of services and programs, and I think we all feel that there's more need in our districts than we can respond to. And unfortunately, that's just the situation, especially right now, given our budget challenges. I always say this is just a moment in time and things will get better. So we will hopefully have more resources in the future. But when we talk about equity, I would also just look at the bigger context. And for District 5, if we're talking about healthcare, for instance, in terms of resources of the 15 health clinics and 4 hospitals, District 5 only has 1 health clinic. And so I feel that the resources are being distributed according to need, which is fine. But again, as folks, as you've all recognized, we all have needs, and I just wanted to highlight that and to just ask for a little bit more of a balance in this program, and understanding that this is just one. And I look at this, having done it once, as really, as supervisors, we know our districts best, I would say, and so we, we can help the organizations that may not be able to clear the hurdles of getting a contract with the county, for instance, or other ways of funding. And I've also really appreciated how folks have been innovative with the funding that they've received. And so that was really my hope, was to be able to offer those opportunities for all of our districts. So that's why I brought this forward. But I mean, I would like to be a part of the conversation. If Vice President, you would be willing to work with me on that, because I do have a lot of reflections from having done this this past year.
Yes, President, good.
I'm
Please.
sorry, through the chair, I apologize. Yes, I am Brown Acted with Supervisor Ellenberg, and I think the Brown Act still stands, but I think that we could have a conversation on the dais about this at some point. Listen, I get it. My district needs quite a bit more, and obviously District 2 has 800,000 more than I have, and I'm not going to fight or challenge the concept of equity, because this is what equity looks like. Do I think that we need to add more to the conversation and take more than what the Medi-Cal enrollees are? Yeah, we should. This is definitely not perfect. It doesn't speak to, like I was mentioning, the historical representation and service to my community. The Medi-Cal enrollees don't. It doesn't represent also probably the number of Medi-Cal enrollees who had to fall off of Medi-Cal because of the new changes, or their fear of public charge, or their fear of having the federal government access to their information. All of those fears, the drop in Medi-Cal enrollees probably has impacted my district quite a bit. But it isn't perfect, but I understand equity. I'm okay with it being right the way that it is right now. I'm okay that there is a difference between the districts, even though Like I said, it's quite a difference, and I can see certainly, and I can appreciate the amount that you have, Supervisor Abacoga, because you want to have more for your district. I totally understand that. We all do. I want to come up with a solution that is amenable to all of us and that reflects our thoughts about what we want the equity formula to take part of. Like I said, it wasn't perfect, but what we had before was nothing. We had just equal. Everybody got the same amount, irregardless of districts. So anyways, this is just a step I think, in the right direction. Does it need more adjustments? Absolutely, it does. And, like I mentioned earlier, I'm not pointing anything out in particular. I use my own experience, like I previously, and this is not to point out the differences, but the differences also speak to historical inequities in why people are maybe on Medi-Cal. But we could also take a look, there's more affordable housing in certain districts, so maybe Medi-Cal enrollees would be more likely to live in those areas. But that also ties back to racist policies that sold homes to people of color only in certain areas, right? And that's why we ended up living in certain areas of the county. We don't live in Palo Alto, and we don't live in Mountain View. We live in the east side of San Jose or in other parts. I don't make that up. Those are historical policies that have transcended into what we see now and created the kind of inequities that we see now.
So Young, you've been most patient. There are actually two speakers on Zoom.
Presently, I've been most patient.
Oh, you want to speak first, or you want to listen to the speaker first?
I think I should be afforded the same opportunity to speak as my colleagues on this board.
I'm asking you which one you want. You want to speak first, or you can speak first?
Yes, I would like to speak first. I have been an elected for 1 year and 3 months in my whole life. And in this 1 year and 3 months, across the numerous boards and committees that I've served, I have witnessed East Side being attacked time and time and time again. Whether it be at this body or in other committee bodies such as VTA and the policy advisory committees, where other districts have time and time, and other people, I'm not saying exclusive to this board, I'm saying across the board of my experience, that some of my experience, hearing comments saying that East Side is getting too much, East Side doesn't deserve more, East Side this and East Side that. And the historical context of this county is that as far back as I can go in my understanding of this county, which is about 5 decades, not that I'm 5 decades old, but the policy of Reed Hillview Airport, the redlining history of East San Jose, the way our East Side looks, the way immigration policies have shaped our communities, is that everyone else has made decisions for East Side. And the thing is that we are beginning to turn a tide. And I'm going to say this, Supervisor Arenas, you said something at the last meeting that really resonated with me, that this was disrespectful to quibble over this amount of money. And Supervisor Abacoga, what you've presented today is a handout that says at the very top of it, inventory allocation proposal, reduction of $500,000. But at the bottom of the chart, the total is a reduction of $530,000. And I know that members of the public are not able to see this right now unless this was attached as a document with the ledge file, or was this provided anywhere else in public? Okay, so for the sake of the conversation and public discussion, the proposed reallocation attached to the motion on the floor today is to reduce District 1's inventory allocation by $111,799. The proposed reduction to District 2's allocation is a reduction of $613,822. The reduction to District 3 is $2,926. The reduction to District 4 is $32,117. The addition to District 5 is $230,664, for a total reduction of the inventory allocation across the whole by $530,000. just so that there's context for the public discussion. Are things perfect? No, things are not perfect. And when we talk about equity at this board, when we talk about equity in previous boards, what I've witnessed in terms of the efforts towards equity in this county organization is to right the wrongs of history. We're talking about deep history that we're learning. To me, equity is the Latino health assessment. Equity is centering children in our policies. Equity are the decisions we make across the board, every single board meeting. And this fund, as necessary as it is to support emerging, growing grassroots initiatives, allowing for smaller organizations or community-based organizations to pivot and respond to what's happening to our world right now, is a step towards us achieving that goal of correcting and righting the wrongs of history through an equity lens, but this is not where all of it's resolved. And I also want to remind everybody too that Supervisor Ellenberg had offered, and I seconded at the last meeting discussion, that we will be taking on the management audit reports, the various civil grand jury reports, all the investigations and the inquiries into the inventory process to FGOC for thorough and deep vetting to bring back to the full board for discussion, because this is a flawed process that clearly is not achieving the goals that we are setting out to do based on the discussions and conversations we've been having. And a lot of work was done to allocate this equity metric from years past, from discussions past. This was not a short conversation the last time we had it at the board meeting. And like I said, this is to quibble over this amount of money is not how we achieve equity. And Supervisor Arenas, like we saw, I staffed CSFC. I know that's a committee that's close and near and dear to your heart. And that was my first assignment as a policy aide. And the warning signs were already there. The movement of people from East Side to South County, the transition of case numbers in DFCS, elevating in South County, right? Those are our shared communities. And I'm gonna say this for everyone to hear, I feel a very strong kindred spirit with the families of South County. Our demographics look increasingly the same. Our challenges are the same. And I have been fully supportive of everything that can be allocated and invested in South County, knowing that our families are crossing boundaries back and forth. They're related to each other. They connect with each other. They go between our districts for services because of the natural movement of families being priced out of East Side, going to the last place in the county that remains affordable, and that's now being priced out. Yeah, and I remember that your predecessor never took part, and he's a nice guy, never had anything against him, but the thing is that he did not look at South County with the lens by which you do, which is a lens that I share and fully support. I don't believe that this county operates as a zero-sum game. We don't do that. That's not how this county has raised me. This is not how this board has historically made decisions. And thank you, President Lee. I really needed it to state that for the record today. Thank you.
Sure. I do have 2 speakers, right? Oh, now we have 5 speakers. Okay, let's do 2 minutes each. Thank you.
Yes, we will. We have 5 speakers on Zoom and none in chambers. We will close the queue. Our first speaker on Zoom is Raimundo Armendariz.
Good afternoon. Can everybody hear me?
Yes.
We can hear you.
Hi, good afternoon. This is Raimundo Armendariz. I'm the Executive Director at Clara, Community Agency for Resources, Advocacy, and Services, and we serve South County. Our agency has been in operation in Gilroy, California since 2011, so we have 15 years of history working in South County, and I just wanted to express that we are in complete alignment and agreement with the comments and views of Supervisor Arenas and Supervisor Yun. I remember Supervisor Arenas' predecessor, Supervisor Wasserman, and I actually advocated to him to try to get further investment and funding and resources for South County, which were ignored. And so all that has kind of culminated in this really excessively high youth arrest rate. I know that we at Caras have been advocating in since 2022 to have a youth center built in Gilroy. I know that that was a part of the Strong Neighborhood Initiative back in 2001 in San Jose and was relatively successful. So those are some of the efforts that we've been trying to push or advocate for in Gilroy. And the reason that connects to this inventory budget is because the inventory budget that has really not really been invested or been very robust in South County is how we fill those gaps of things like youth services and prevention and intervention to lower excessive arrest rates and excessive crime rates. And if you pay attention to the Santa Clara County Juvenile Justice Report just released in November of 2025, it shows that 95020 or Gilroy zip code is the highest for arrests for felonies of youth. And it's also the highest for minors who are incarcerated. And so this inventory budget, this funding and equitable distribution of inventory funding is a way that we can fill those gaps and address these issues impacting Latino youth and youth in general in South County. And again, thank you both, Supervisor Yun and Supervisor Arenas, for your comments and your support for South County. Thank you.
Thank you. Our next speaker is Marty Estrada. Marty Estrada, are you there?
Yes, I'm here.
Please go ahead.
Yes, thank you, Board of Supervisors. I also echo the comments of Sylvia and Betty. This is about equity. This inventory budget's needed in South County, and all nonprofits need it. This is not something that's debatable. We rely on this inventory budget to support our services in South County, particularly youth in general, to provide them access to a place called the Hub. We have a youth hub and services that are related to that. But it goes beyond the youth services. It goes also with their families. Holistically, we reach out to them as well. We also had a program that we provided supportive services to the Latino population, Latina, in providing health and wellness. And that is gone because the Trump administration shut that down. We need this little bit of pennies that we get from the inventory budget to support the needs of South County, as well as the other nonprofits that need it as well. This is not something that y'all should be trivially looking at to try to figure out a way to cut it. You should keep it in place because the benefits of that is providing services that it's going to come back to the county if you don't, because in terms of hospital visits and so forth, so frequent filing mileage. So we got to make sure that we keep that inventory budget standing as it is at $7 million, not cut it. Figure out a way. Why don't you cut the monies from the district attorney who are getting tons of money? Their budget is massive and they don't need that. Cut their budget and give the nonprofits a hand up with this inventory budget and keep it in place. I would even suggest to you increase it to make sure that we're providing services across the board for Santa Clara County agencies that need the support to support their communities. This is a community effort. We all support the marginalized communities, and we're doing the best we can. We need your support to continue the funding in the inventory budget. Thank you so much.
Thank you. Our next speaker is Christine Pham. Christine, are you there?
Hi, can you hear me?
You are very quiet. Why don't we come back to Christine Pham?
Can you hear me?
There we
Now
go.
we can, yes.
Please go ahead.
Hello, can you hear me?
Yes.
Oh, hi. Good morning, good afternoon, supervisors and staff. My name is Christine Pham, and I'm here today on behalf of Healthier Kids Foundation as the manager that oversees our screening program and as a resident of District 1. I am here asking you today to vote in support of equitable funding allocations for the Supervisor Inventory Grant Program. As a nonprofit partner that actively serves Santa Clara County, we consistently see a high need in both East San Jose and South County. So for example, on average, when we conduct our dental screenings in these communities, we see more than 30% of children screened with urgent or emergency dental concerns. Across all of the programs we operate, we do find a consistently significant higher rate of need in East Side San Jose and South County. And we encourage the Board of Supervisors to maintain increased equitable funds available for these higher need communities. The Healthier Kids Foundation is incredibly grateful to the Board of Supervisors and the Santa the County of Santa Clara for their many years of support that have ensured that more than 500,000 services provided to children and families in our county. Thank you.
Thank you. Our next speaker is Victor Vasquez.
Good afternoon, Victor Vasquez, Hoy Día Somos, also representing the Youth Building Peace Coalition. And it's really interesting that we are still having a debate around equity versus equality in these times, and also fighting over what resources should be distributed and to who. Just want to take a step back. This is part of a larger agenda from our federal government to create this type of crisis, this type of division, where we have strong leaders like you all having these discussions. And I think that we need to take a step back and remember our commitment as a county. All of us, I believe, are committed to justice or equity, like they say. And I want to remind us of that because this is what they mean to have us do. These types of discussions where we're trying to scramble for resources and dollars when we know we live in a county and a nation that has enough. And I think we also have to look at different spaces like the previous speakers have mentioned. We have inflated budgets that support the incarceration of young people that we should be looking at and taking from and moving that negative funding into positive youth interventions and empowerment programs. And those programs should be funded, yes, through equity lens. The data shows District 1 and 2, Latinos, African American communities, young people with disabilities, trans and gender expansive youth. These youth who are marginalized in these communities should have a equitable distribution of resources coming to them. It doesn't mean that the rest cannot get anything. I think it's just how we start and when we start to fix the problem. I also want to just gently remind you, I send you all a letter with our 10 youth empowerment demands that also includes children, and I would appreciate if we can get a chance to meet it.
Thank you. Our next speaker is Saul Ramos.
Good afternoon. Again, Saul Ramos with Somos Mayfair. And yes, I want to acknowledge what Victor was mentioning in terms of the current environment and how this deficit mentality often hit us in different ways, product of racism and white supremacy. But I also want to acknowledge that this has been a courageous and important discussion, right? I think it matters that the county is willing to engage in its defined meaning of equity, because often institutions, they tend to fall on sameness and, they call that fairness. So I appreciate asking and hearing the harder questions, because what I hear is not whether every district gets the same, but whether communities are receiving what they actually need. And from our perspective in East San Jose, that matters a lot. You talked about the experience, generations of underinvestment. Victor just spoke about youth issues, high poverty, language barriers. And families in these neighborhoods are not navigating the same conditions as families in more resource areas. We know that. So really equity, what it's asking us to do is to respond to lived conditions and ask us to recognize where the burden is heavier and where the barriers are getting greater and where the consequences of under-resources are more severe. In that context, I think directing more inventory items to districts with greater need is not favoritism, it's not imbalance, it's really a responsible and grounded way to address our realities. So again, I do want to acknowledge the county for leaning into this conversation, but I do want to encourage us to really look at this as an opportunity to address the gaps that our partners at Clara has mentioned, and opportunities to address gaps in our youth and service provision, and also to address displacement as well. So if we're serious about our allocation, we must reflect the conditions the communities are facing on the ground. Thank you so much.
Thank you. That concludes public comment.
Thank you. Supervisor Abakoga, your light's still on.
Yeah, thank you. Well, I'll just say I do appreciate the conversation. I picked this proposal that President Lee put out because it was another proposal, but frankly, I would wanted to maintain the 5 million. You know, I would like to maintain the 7 million that we had before, but it's again the competing interests and situation where I've also felt that we had to do our part too, as you know, from our offices as supervisors, to contribute to the overall you know, reductions that we have to make. But again, I appreciate the conversation. I appreciate the last speaker and how he framed it. You know, I see the needs, and I look at the entire county. I definitely, you know, I have to fight for my district too, but I do see the needs, and you know, I would ask, you know, everyone, we're all, at the end of the day, like our logo says, we're one county, one future. And so, I mean, I do try to look at everything in that, from that perspective. You know, I fought for the East Side Connector project, and I, you know, defended it from a lot of criticism. So, you know, I totally see that, and I try to do my best to see where we need more support and resources. But I guess what I, you know, have to say too is that I know that my district has needs as well, and sometimes they're actually more hidden than in other places. And when I have communities, and you know, as a city council member, we were fighting to try to keep our community and keep our socioeconomic diversity by doing what we could to support that. You know, that's where I come from, in that desire to try to make our community a community for all. So that was really, you know, what I was asking for was the consideration of that. I understand, and I think there is a lot of discussion that we need to have around this in terms of what we do moving forward. So I look forward to that discussion, and I would just ask that we do it before next year. Frankly, this sort of came out, you know, suddenly during the mid-year. I don't know if that's how it was before, but I think we're also just in a different place because we're having to look at reductions instead of even maintaining what we had before, which is what we did last year. So thank you for indulging in a discussion. I appreciate that. I know my motion is not going to be seconded, so I will withdraw it. Thank you.
Okay, let's have another motion.
There needs to be a new motion made.
Right, I need a new motion.
I move that we approve the item as recommended by staff.
Second.
Moved and seconded. I don't see any further discussion. Correct? Supervisor Young, you're lighting up to
I'm ready to
speak?
vote.
Oh, to vote. Okay, thank you. All right, so Chris, let's take the vote.
All right, that was a motion from Supervisor Ellenberg, seconded by Vice President Arenas. Supervisor Abacoga.
Aye.
Supervisor Young.
Yes.
Supervisor Ellenberg.
Yes.
Vice President Arenas.
Yes.
President Lee.
Aye as well.
Motion carries with 5.
All right, I believe this is the last item on the agenda. Am I correct, Curtis?
That is correct.
Well, guess what? We will be back here again on Friday. Yes, the lucky Friday the 13th at 5:30 or 5:45, I believe, is when the door opens. But try to get there early because we do have a lot of RCP, and we believe this will be a packed house. We will be also opening the INS as overflow as well. Should be a fun event. That will be the state of the county that I'll get to share with you all the great things this county has done this past year and what we plan to do in the next one. And on that note, thank you very much for being here, and the meeting is now adjourned. That the record shows 1:08 p.m. Thank you.